Good morning, everyone, and welcome to the House Committee on Health, Human Services, and Elderly Affairs. As you know, we have several hearings scheduled for today, but before we get to those, I'd ask you to please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. The first bill to be heard this morning is HB 1790 FN, and is Representative Long here? I don't see him. Yeah, Representative Weber, if you would introduce it, that would be wonderful. Thank you.
Good morning, Mr. Chairman, valiant members of the committee and the public. As a courtesy to Representative Long, I am Lucy Weber. I represent Cheshire 5, Walpole, and Surrey, and I am introducing as a courtesy to Representative Long House Bill 1790 FN relative to involuntary admissions for certain individuals with a substance use disorder. That concludes my remarks, and I will take no questions.
Thank you, Representative Weber. Just digesting the latest entries here. Okay, also signed up, oh, that's a different bill, never mind. Also signed up to speak is John Burns, I believe it is, from the Recovery Community Center. Sorry, I can't read all of it. Yep. I have bad handwriting too, but I think we're competing with each other.
Good morning. Thank you for the opportunity. It's on? Is that on?
Yeah. There you go.
Good morning, and thank you for the opportunity to speak. My name is John Burns. I'm a person with lived experience with substance use and recovery. I am also a family member who has run family support groups for several years. And I'm the executive director for SOS Recovery Community Organization with centers in Rochester, Dover, and Exeter. I come here in opposition to this bill, and I come here with much lived experience, specifically on the topic of involuntary commitment for substance use disorder. As a parent, I look back and one of the greatest mistakes I ever made, I feel like, in my daughter's journey, who was an injection drug user at the age of 16, was my willingness and desperation to involuntarily commit her, to such extents that I had at one point rented out my house here in New Hampshire, moved to Massachusetts to access, for the sole reason of being able to access their Section 35. Which is an involuntary commitment. At that time, I was employed in Massachusetts, but that was really the primary motivation of renting an apartment down in Massachusetts at that time, several years ago. I successfully sectioned her, or unsuccessfully as I look back, twice. And I think one of the important things that we need to consider when we look at involuntary commitment for substance use disorder is that most of the research out there shows it does not work. I believe there was just a review of literature that showed, of studies, and out of 42, 35 of them showed that it was no more successful than voluntary commitments. And the reality is the response to people with a substance use disorder of stripping them of their autonomy is a poor decision. And what we fail to realize is weighing the value of that involuntary commitment against the trauma that we inflict upon them. And when I look back, what I did to my family member was put her in situations that created significant trauma. There is not a lot of good that can come out of having, as a parent, having your kid wheeled in handcuffs and put into a carceral system that really didn't provide the treatment necessary for her she came out both times without any success. What did work for her was being able to do it at her own pace and several years later accessing harm reduction services in the inner city of Boston, where they connected her to housing and treatment and all of that, and she maintains that recovery to this day as a result of accessing those supports. We need to provide compassionate care for people. We need to provide them autonomy rather than strip them of it. And and the path to getting people to consider their treatment is one that they have to choose, and one that they will choose if we are willing to meet them where they're at. And that might be just working on things like behavioral health supports, building foundations of getting them housed when they're unhoused, providing support for food insecurity, and providing all of those basic needs. It's something we do at our recovery centers every day. I can't tell you how many people have come through our doors who were not willing or interested in going to treatment. And a couple of years later, they show up and they're like, you were the only people that didn't judge me and provided me with supports to build a foundation where I'm ready. Can you help me now? Because I know you won't judge me. So I think it's very important I think this bill doesn't provide a whole lot of resources. And when I look at what we have for resources, I don't know how this interacts. I don't know how this works. I suspect they're going to commit people into New Hampshire Hospital. We already have people backed up in hospitals all over the state because of the fact that they don't have appropriate mental health care and do need involuntary commitments for mental health. We need to build infrastructure. We need to rely on the recovery centers and harm reduction programs that are across this state and providing those peer-based supports to support people versus trying to force them into a carceral system that just will not support them at all.
Thank you, sir. Thank you. Are you taking any questions?
Sure, yes.
Representative Lucas.
Yes.
Thank you, Mr. Chairman. Thanks for taking my question. I would like your opinion. I wonder if this involuntary incarceration in some ways mimics the experiences that might have contributed to the substance use disorder to begin with.
Yeah, I would say much higher than I see statistics of 50-60% of people have a trauma history that are suffering with a substance use disorder. Based on what I see every day, it's much higher than that. And I think we are just adding complex trauma to complex trauma when we try an involuntary commitment.
Thank you.
Anyone else? Any other questions? Okay, I see none. Thank you very much. Good morning, Representative Long. We have started the hearing. Would you like to speak? Yes. Representative Weber introduced the bill for you, but certainly we're happy to hear from you also.
Right. Thank you for the introduction.
Representative Long is the prime sponsor of this bill.
I apologize for being late. Shoveling out the driveway took a bit longer than I anticipated.
It was a challenge. I did it last night. It's a challenge for sure.
Well, I did it last night and I thought I'd done a good enough job, but there were some spots that were just enough to get stuck on. So one thing I want to bring up, so DHHS has asked to amend the bill to make it a study commission for now. And with some hesitation, I'm willing to agree with that idea. I hesitate because the governor's office already did a study on this a few years ago, which is basically sat on a shelf. So I think it needs to be something more productive than that. And I think the key to making it productive is that the commission needs to focus specifically on implementation details and not just a broad survey of what other states are doing and what the problem is. We know the problem. We know what other states are doing. And now we need to think about what this would actually look like to do in New Hampshire. I think there's a need for the option of involuntary commitment. It's something that's helped in other states. I practice law in New Hampshire and Massachusetts, and involuntary commitment for substance abuse is done somewhat frequently in Massachusetts. It's not the only thing that needs to be done, but it's one tool in the toolbox to help people with severe, dangerous addictions that need to be addressed immediately for their safety or the safety of others while avoiding incarceration and a criminal record. And since I'm sure the question will come up, it's solving a different problem than the drug courts, which are designed to address addiction specifically in the context of it leading to criminal behavior. and which require a guilty plea and then completion of the drug court program as a condition of probation or parole. There is probably some overlap in who might end up in drug court versus a civil commitment, but the intent is to include addictions that are dangerous to the addict themselves, even if they're not leading to criminal behavior, and to avoid giving them a criminal record as a result of their addiction. I do think there are a lot of questions that would be helpful to get answers on before proceeding, which is why I am willing to sign on to DHHS's idea of a study commission. Most significantly, what do we do about our capacity issues at New Hampshire Hospital? Massachusetts handles this by putting men who are committed within a correctional facility most of the time. So it's technically a civil commitment. It doesn't come with a criminal record, but it does come with all the restrictions of jail time. So it's generally a more restrictive lifestyle than might be in a hospital or in a rehab program. I'm not sure that that's the optimal way to do it, and it is worth evaluating alternatives before implementing this. Additionally, questions like what would the staffing need to be, meaning what positions would they need to hire for and what ratios, how should the facility prevent or respond to elopement, who is responsible for handling the acute withdrawal phase for drugs such as opioids, where the withdrawals themselves can be life-threatening, not just the drug itself, and what should the maximum length of commitment be, and should aftercare be mandatory. So many of those questions were raised in the previous report by the governor's office, but they weren't really answered, and I think we need to get answers to them now. Thank you for your consideration.
Thank you. Representative Weber.
Well, you addressed a bit about how this is done in Massachusetts, but my question for you is, should we pass this, where exactly are the people going to go?
Well, I think that is the big question, and I think that's why I'm willing to sign on to DHHS's proposal to make it a study commission for now, rather than go forward completely. I think the default answer would be New Hampshire Hospital. There are capacity issues there, as I mentioned, and that is a problem with implementation. The Massachusetts workaround is to put people in jail. Potentially there may be rehab programs that have beds available that would be appropriate, but they would have to be probably more secure than a lot of rehab programs are when people are there voluntarily, because there is a risk of people trying to run away.
Thank you.
Any other Representative Woods?
Thank you, Mr. Chair, and thanks for taking my question. Again, following up on Representative Weber's question, did you have any idea how much of an impact it would have on the state hospital in terms of population and turnover? Because the turnover is significant as well.
I am not completely sure. I know Massachusetts has, if I remember right, about 6,000 involuntary commitments based on substance abuse a year. So I would assume it would be roughly proportional to that based on our population. But I don't know for sure.
Representative Hartnett.
Thank you, Mr. Chair. Thank you for taking my question. Do you know of any states that have implemented this and have had what anyone would consider a success rate?
Well, I think it's always a success rate when any individual who is endangering themselves with their substance use is able to get sober and stay sober. So I don't know what the specific numbers long-term are, and a lot depends on what happens afterward. But I will say my experience as an attorney is I've had clients who even have gone to jail and said that it saved their life because the 90 days of enforced sobriety was what they needed to turn their life around. And then once they'd had that 90 days, the addiction had broken its hold enough that they could stay sober.
Thank you. Thank you for taking my second question. Are there any states that you can identify that are model states for the question of probable cause?
So it actually is a higher standard than probable cause constitutionally. It has to be, for any sort of civil commitment, there has to be clear and convincing evidence of the problem, and that's nationwide, because that's the constitutional standard for civil commitments, because it is a significant infringement on the liberty of the person being committed.
Anyone else? Seeing no one else, thank you. We do need a pink card from you, by the way. Okay, also signed up to speak is Cynthia Bellonis and Kaja Fox from New Hampshire Department of Health and Human Services. And Ms. Fox, if I didn't pronounce your first name correctly, I apologize. Was I close?
Yes, good morning. I'm Katya Fox. I'm the Director of the Division for Behavioral Health. And with me is
Cynthia Babonis, Chief Community Integration Officer at New Hampshire Hospital.
And thank you for the opportunity to be able to speak about this really important issue. And I thank the sponsors for putting forth a bill that allows us to speak about the situation and substance misuse in New Hampshire. It's always good to be able to have these types of discussions and talk about what we're doing and where there may be gaps in our system that we need to fill. So when I read the bill, the first thing is, oh my gosh, where are we going to put people? But what I think we need to think about, and I appreciate the offer to look at a study commission, is not just how we're going to do this, but why we're going to do it. And so I think there really is that policy decision that needs to be made about how to address substance misuse in New Hampshire. We have made great strides over the last 5 years in seeing the reduction in overdose deaths, and those have been accomplished because of the investments that we've made in the system. And so you heard from a recovery community organization, that's part of the answer. We have the wide distribution of naloxone, we have medication for addiction treatment, and we have a multitude of community-based services that have been put into place to help us reduce that rate. And again, I think that as we look at this, we have to look at it from a policy perspective, but we also have to look at the financial cost as well. And Cindy can talk a little bit about what we've put together, which is probably an underestimate of what would be needed to be able to pull this off.
So the concern that we're trying to help provide information for on this bill is that it does not provide funding or authorize new positions. However, it creates significant obligations for DHHS. This bill would substantially increase the population served by New Hampshire Hospital, requiring additional bed capacity and staffing. The estimated cost for implementation is for construction of a new 70-bed facility, $40 million. To accommodate increased involuntary admissions. An annual operating cost in addition to that is projected at $33.3 million, with only $2.3 million offset by insurance revenue, leaving $31 million per year to be covered by general funds. This fiscal impact is an estimate derived from the number of annual fatal overdoses. However, the actual number of individuals who would meet the criteria for IEA under this proposed bill is much higher, as it would also include those deemed dangerous to others, a figure that cannot be accurately determined. Individuals committing crimes while under the influence, including DUI, would fall into this category. Therefore, we acknowledge that this estimate represents a significant underestimation of the potential physical impact. There's an additional administrative burden. It would be via increased demand for clinical evaluations, court hearings, and legal proceedings which would require more psychiatric staff, legal staff, licensed alcohol and drug counselors, and recovery coaches. Estimated additional legal costs exceed $600,000 annually. System upgrades would be required. The department systems for admission tracking and reporting will need updates to comply with new statutory criteria. Again, the bill authorizes no appropriations to cover these costs, creating a structural deficit. Thank you.
Thank you.
And just to follow up, again, looking at the investments that we have made and the difference it's made, should not be understated or unrecognized. That has made a big difference in the lives of the individuals who have been able to get successfully into treatment, and for their families. We know that families are part of the equation, and that there are family supports, and there is work to be done about connecting people to those community-based services. So public awareness, connection, coordination, and outreach are all important factors. The Governor's Commission on Alcohol and Other Drugs has a new name now, but about 6.5 years ago, did issue that report. I would encourage you to look at it. It was not intended to be what has been thought of as a study, what we would consider a study commission. It was a task force that did basically a literature review to report out to the Governor's Commission. And so a refresh of that and looking at the issues that were raised then would be great, but it also really needs to focus on why are we doing this at this point in time, and is it the right fit for New Hampshire? And with that, I'd be happy to take any questions.
Thank you, Representative Hartnett.
Thank you, Mr. Chair. Thank you for taking the question. Can you identify any states that have implemented a similar law that have studied the implementation and what their outcome analysis was?
We have the report. There was at that, again, that's 6.5 years old. So I think I have not done a thorough review more recently, but I think that the outcomes are still considered to be mixed. And again, speaking about the reference to the prior speaker about the effectiveness, is there one state that's doing it right? I don't think so. And would we want to replicate what another state is doing? It may not be the same factors that we have here in New Hampshire.
Representative Lucas.
Thank you, Mr. Chair. Thanks for taking my question. That was a really thorough review of the financial impact. Could you expand a little bit on the policy needs that, as you see them?
So I think, again, this really needs to be fully vetted. We know what has contributed to the reduction in overdose deaths. How do we get to zero is another question. And I think that's something that we would want to look at other policies to do a deeper dive. But there is no doubt that investment in community-based services is the policy that has worked thus far in New Hampshire.
Representative Kesselring.
Thank you, Mr. Chair. Thank you for taking my question. So I'm thinking back, and help me refresh my memory. How many beds was it that you said at New Hampshire Hospital before were waiting for kind of to get them out of the New Hampshire Hospital that could be moved?
So our total capacity is 185, and pretty steadily about 100 of those patients are stable and ready for a step down to a less restrictive setting.
If I could just add to that, ready for less restrictive setting means housing and supported housing in the community. And that's really what we're running into today, is making sure that there is enough housing for people who need it. Recovery housing is another area that there is a crunch. It's really hard for any type of housing, especially if you have a substance use disorder or a mental health condition and need those supports. So I think investments in housing are a key factor and policy that people need to explore as part of any discussion about how we address the needs.
Thank you. Any other questions? Okay, I'm seeing none. Thank you very much. Also signed up to speak is Jake Berry from New Futures.
Good morning, Mr. Chairman, honorable members of the committee. My name is Jake Berry. I'm the Senior Vice President at New Futures. As many of you know, New Futures has been working for nearly 30 years to help address substance misuse and behavioral health issues in our state. I don't want to repeat too much of what's been said here this morning, but I do want to emphasize New Futures' many questions and concerns about this bill, many of which are cited in the written testimony that I just handed in. To summarize, looking around the country, as you've heard, there's not a significant body of evidence to show the true impact of involuntary commitments for substance use treatment. If you look hard enough, you may be able to find some studies that indicate positive impacts, yet there are more that show potentially increased overdose, risk of overdose or death of individuals after they're released from involuntary commitment. Excuse me. Specifically in Massachusetts, which has been cited this morning, there was a state study released in 2024 that showed that individuals coming out of involuntary commitment have a 1.2% higher chance of overdose and potentially an increased risk of death versus those who are released from voluntary commitment. Either way, again, the research that's available is largely inconclusive at this point, and I fear that if enacted, this bill could have severe unintended consequences that undermine the work we've done to build our treatment system and lower overdose rates in our state. What's more certain at this point is the severe fiscal impact this would involuntary commitment would have. As you've heard, to accommodate involuntary commitment would require other states have had to spend millions of dollars to expand capacity, whether that means new facilities, adding beds to existing facilities, hiring treatment providers, expanding case management, or other services, among many others. Once again, in Massachusetts, the governor budgeted more than $22 million in 2023 to finance the state's alcohol and substance abuse center, the facility used for involuntary treatment. As you saw in the fiscal note, and as you just heard from Director from DHHS, they're projecting more than $40 million. That's because New Hampshire simply does not have the infrastructure. We don't have the number of beds that would be needed. We don't have the workforce that is needed. All this to say, there may be a time when involuntary commitment is needed, part of our treatment system, but we're a long way from there. There are many unknowns, many questions about the efficacy and cost effectiveness of this practice. I fear to rush into this at this point would threaten more harm than good, would undermine the progress that we have made. And with that, I'm happy to take questions.
Thank you. Any questions? I'm seeing none. Thank you.
Thank you.
Also signed up to speak is Holly Stevens from NAMI of New Hampshire.
Chairman McDonald and members of the committee, my name is Holly Stevens. I'm the Director of Public Policy at NAMI New Hampshire, the National Alliance on Mental Illness. Over the years, NAMI New Hampshire has heard time and again from loved ones with substance use disorders worried for their loved one's well-being. They express a desire to get their loved one treatment in any way possible, including involuntary treatment, as they fear the substance use disorder may lead to the death of their loved one. But despite all that, we are today opposed to House Bill 1790 for two basic reasons. First, as you've heard, the evidence doesn't show that involuntary treatment works, and New Hampshire does not have the capacity for more involuntary admissions as the ED boarding crisis remains. You've heard from a few folks regarding that the research doesn't show that involuntary treatment works, so I will not go through that. But there are 35 states in the country that have laws on the books, about 35. I've heard 35 to 37. But most of them don't use this anymore. The two primary states that use involuntary treatment are Massachusetts and Florida, from the reading that I've done over the past week or so. But in addition to the what the research shows, New Hampshire is still in an emergency room boarding crisis, with 25 individuals boarding subject to an involuntary emergency admission for psychiatric reasons, and 15 others waiting in ERs on another legal status, such as voluntary or revocation of a conditional discharge as of yesterday. Also, given that New Hampshire Hospital is not a medical facility, the largest hospital that takes involuntary individuals is not right now set up to take acute detox patients. Therefore, the remaining designated receiving facilities that are connected to a medical facility would be responsible for taking all of the involuntary SUD patients under our current system. Our current system is in and has been in a fragile state for years. With the work of Mission Zero, the ED boarding numbers have been coming down, but with the passage of a bill like HB 1790, that would derail the progress that we've made, and it would lead to longer wait times in the ER for all individuals, including those with physical health conditions, because those beds would be taken up by individuals with substance use disorder waiting for an involuntary bed. So simply put, there's no evidence that involuntary SUD treatment leads to positive outcomes and likely leads to more negative outcomes. And additionally, New Hampshire's mental health system does not have the capacity for more involuntary patients. Therefore, NAMI New Hampshire would urge the committee to vote inexpedient to legislate on House Bill 1790, and we suggest that any money spent go towards voluntary inpatient and outpatient community resources for individuals with SUD, because those have been shown to actually work. Thank you for my testimony.
Perfect timing. Thank you. Any questions? Representative Lucas.
Thank you, Mr. Chair. Would you mind just clarifying, thanks for taking my question. If you could clarify, did you say that New Hampshire Hospital does not have the facility for doing detox treatment?
It's my understanding they have the knowledge and the know-how, and can they do it on an emergency basis? Absolutely.
Okay.
But to take in a whole bunch of patients, as somebody, I mean, I know that, and I talked about my work in Maine last time I was here with you folks.
Right.
And our, two main psychiatric hospitals that were not attached to medical facilities couldn't take SUD patients. And, it's my understanding that New Hampshire Hospital does not take voluntary SUD patients at this time if there's no medical diagnosis with that. And I think, Katja Fox and Cynthia Babonis could clarify that if you wanted that. And I'm happy to talk with them and get that answer to you. But it's my understanding that they don't take straight SUD patients at this time. And it would be a change for them, and also would probably likely need added facilities to make sure if there was a medical emergency due to a detox that they had the facilities they had to be able to take care of those folks.
Thank you.
Anyone else? Okay, thank you.
Thank you.
Also signed up to speak is Anina Hansen.
Good morning.
Good morning.
Mr. Chair, members of the committee. My name is Anina Hansen. I'm from Peterborough, and I am a person in recovery from alcoholism. So I'm more or less testifying in opposition to this bill. I'm really just here to give a little bit of personal context around it. I have several stories from my own experience that speak to this. The first is my first sponsor, who, when I was about 2 years sober, we were living in a place where IEA was legal, and she had that, she initiated that for her son, who was 23. It was a rehab that was set up for IEA and had all the proper protocols for that, but because he was there very much against his will, he did not cooperate with giving the full details about his substance use, and they were unable to manage his withdrawals correctly, and he died the next morning. So that speaks to the risk that can occur when somebody goes in when they're facing a life-threatening withdrawal, and they just don't want to be candid about it because they don't want to be there. I have another experience from my life partner who actually, he was in the New Hampshire legislature. He served, in fact, on this very committee. His name was Phil Spagnolo. For anybody who might remember him, he died in 2021. He was clean and sober until he wasn't, and then he died of a fentanyl overdose. And of course, there were many things after that that I looked back and wished I could have said or done or known. But there was not a point where I wished, oh, if only I'd had the ability to put him in a facility against his will and forced him to stop. That's a little bit neither here nor there because, you know, if I could go back after his death and have that option, would I have chosen it to keep him alive? Obviously. It's just that it's more nuanced than that. And then that really comes to my own experience. I, this year, will, inshallah, be celebrating my 10-year sobriety anniversary. When I quit drinking in 2016, it wasn't because of the friends who'd sat me down and said, we're really worried about your use. I just was completely offended by that. Very defensive, not interested. I did not have a problem. And then the day that I got it was the day that I got it. And it wasn't because anybody forced me. It wasn't because anybody tried to get me to go there. And so when I look at myself and I look at Phil, I have that awareness and conviction that as earnestly as we desire the well-being of our loved ones, we don't have the power to make somebody else make a choice. And nobody could have had that power over me. Certainly nobody had that power over Phil. So I so appreciate the intention of this bill and the intention that we want to keep people alive when they are a danger to themselves. My guy was a danger to himself and he died as a result of it. I don't take that lightly. I don't dismiss it. It's just that it's so much more complex than that. And we can't consider this issue without being aware of that full level of being human, and that at the end of the day, it really just comes down to when a person's ready, they're ready, and when they're not, they're not, and we don't get to make that choice for anybody else. So as has been stated, based on my experience, what I think would be most effective would be to take this desire to help people and point it in a slightly different direction where there is more evidence to back up the efficacy of it. But I appreciate the desire, and I hope that this committee will have those opportunities to take moves to legislate, putting money into programs that are not just, helping people currently in addiction, but even stopping the addiction before it starts. Huge fan of intervening early with childhood trauma issues. That's what I do professionally now. I'm involved in that. And the sooner we start with that, the more money we put into supporting youth who are right at the beginning point or even better before it, then we never even get to that point down the road where any of this is an issue anyway. So I think that is all I have to say. Thank you for hearing my testimony.
Thank you very much. Representative Weber.
I just wanted to say that I served with Representative Spagnolo, and I'm terribly sorry for your loss. It was a great loss, not only for you, but for the community.
Thank you.
Any other questions or comments? I'm seeing none. Thank you.
Thank you.
No one else has signed up to testify on this bill. Does anyone else wish to testify? Seeing no one, I'm going to close the public hearing on HB 1790 FN. Our next hearing is scheduled for 10 a.m. on HB 1773 FN, and we will be in recess until then. Okay, welcome back to the House Committee on Health, Human Services, and Elderly Affairs. Next up is HB 1773FN. I don't see Representative Freeman here at the moment. She may join us in time, but in her absence, I'll recognize Representative Kesselring for the purposes of introducing the bill.
Thank you, Mr. Chair. I am Representative Stephen Kesselring, serving Hillsborough 18 in Manchester. I am introducing 1773 FN for the prime sponsor, and I will not be taking any questions.
Okay. Thank you very much. Okay, thank you, Representative Kesselring. Signed up to speak are Karen Hebert and Brian Clark from the Department of Health and Human Services.
Good morning, Mr. Chair, members of the committee. My name is Karen Hebert. I'm the Director for the Division of Economic Stability.
Just a moment, please.
You need to point the microphone directly towards your mouth, otherwise.
Sorry. Oh, now it's really loud. Good morning. My name is Karen Hebert. I'm the Director for the Division of Economic Stability at DHHS.
And I'm Brian Clark, General Counsel for the Division of Economic Stability. And we're here to talk about what this bill would require of the Department of Health and Human Services and the changes that would need to be made. So I guess to start off, I'd like to talk about the education and outreach requirement within the bill. It requires, as part of the waiver request, that the department shall establish an outreach and education program to help SNAP recipients make healthy choices. So the department currently has an outreach program, but we no longer have a nutrition education program due to a change in federal law. That program ended, and the federal funding that we had been using is no longer available. It used to directly educate 500 individuals and 100 community organizations on healthy choices for SNAP recipients, and outreach was done to 400,000 individuals via social media. And we estimate the cost to either restart or set up a similar program to be about $1.2 million per year.
So I'm hoping that I can provide you with some helpful, useful information about the Healthy Choice waiver, Healthy Choice program. It is new with the federal, with the U.S. Department of Agriculture, specifically Food and Nutrition Services under the USDA. You may be aware a number of states have implemented or submitted a waiver to the federal government for this program. So essentially the program could be set up and implemented in one of two ways. The first way is essentially at the retailer level. So there are over 1,050 retailers in New Hampshire that participate in the SNAP program, who accept SNAP to pay for purchases at their stores. This is the current system that's in use. Essentially, all the products that are purchased have to be coded by the retailer as either they're eligible for SNAP or they're not eligible for SNAP. So when at the point of sale products go through the checkout, the system automatically picks up on whether or not that item can be purchased with a SNAP EBT card. Otherwise, the buyer is informed they have to use a different form of payment for that particular item if the item is not eligible. Retailers participate in SNAP by way of agreements directly with the federal government, specifically the USDA, Food and Nutrition Services, not the state, not the Department of Health and Human Services. The department does not receive any data regarding items that are purchased. The only data that we receive is the location where a New Hampshire SNAP card was used and the dollar amount of the transaction at each transaction. Candy and soda items, or really any other particular related items, can be coded accordingly by the retailer. It is a burden. With this option, there may be costs to the state associated with the development of proper notices to SNAP recipients, modifications of electronic files with the EBT vendor, and the possibility of customer service provided to individuals who either have questions or complaints about the SNAP program or purchases that were not able to be made at the retailer. To the best of our knowledge, there are no states that have implemented, well, I'm getting ahead of myself, sorry. The second option is essentially to do this through the EBT vendor instead of the retailer. And note, this is the item that no states, to our knowledge, have implemented restrictions through the EBT vendor level that we're aware of. So the EBT level, vendor level changes involve enhancements to the EBT system, as it would require the ability to identify items that should have been excluded by the Healthy Choice waiver and involve the monitoring of purchases. Retailers would also need to make extensive changes in order to send UPC data in the transaction to the EBT vendor, because that is not information that is sent today. And this would help determine what products are being purchased in order to apply restrictions. The department assumes also that enforcement of the Healthy Choice waiver in this option would have to be done, could be done by via attestation of the retailer and for their compliance with the waiver. The department does not currently audit retailers on whether they accept SNAP benefits for items not eligible for SNAP. FNS, the Food and Nutrition Service, conducts the audits of existing requirements. Many states are currently saying that they do not have regulatory authority or to approve, sanction, or monitor retailers for compliance with federal program regulations. It makes this option a bit more challenging. It would likely be necessary to enter into formal agreements with the over 1,000 retailers for this particular activity. If the enforcement of the waiver was to extend beyond accepting retailer attestation, the department would need to add several investigators and administrative staff for that purpose in order to enforce compliance and implement essentially a system of auditing retailers which doesn't currently exist. The costs for this option, number 2, the department would ultimately need to spend $416,000 for facilitating the retailers using the Healthy Choice waiver. Again, this is all changes that would need to be made if we go by way of using the EBT vendor to conduct this program.
If you could start wrapping up, please.
Yes. There are a number of costs associated with the changes under this option that total essentially almost $1.4 million. There's no appropriation in this bill. So totally, this bill as it is written would essentially would increase expenditures by $2.6 million for state fiscal year 29. It is not clear whether there is federal funding or a match available to support this program. The timeline is also something to note specifically for implementing a program. The federal government advises at least 6 months to request between the request date and implementation. System changes because of contract amendments could take 6 to 9 months. So we're looking at an implementation likely June of 2027. Evaluating reports is required by the federal government during the first year of implementation, and then we would have to submit reports, evaluation reports on an annual basis. The Food and Nutrition Service strongly encourages states to collect data on food and beverage purchase, consumption, and health outcomes by interviewing recipients and collecting qualitative data on purchasing habits and non-SNAP spending, either through a collection of food purchase receipts or 24-hour dietary recall. Most states are using surveys to retailers and participants, and also tracking retailer and participant complaints. Again, we may need to enter into agreements with the 1,000+ retailers in order to conduct that type of an evaluation. Anything further you want to?
No, I think we covered it.
Okay, thank you.
Thank you. Any questions? Representative Lamontagne.
Thank you, Mr. Chair, and thank you for taking my question. Just so I understand this, the federal government is saying you can do these waivers, but they're not providing any funding to implement it. How does that work?
That is correct. They are providing an option to states to allow them to request a waiver to restrict eligible food items. So SNAP has a default rule as to what counts as an eligible food, which is generally just food for human consumption, some restrictions on hot foods. And so they're basically giving states the option to further define eligible food to not include certain things.
Representative Weber.
Thank you. And as a direct follow-up to that, is there any guidance anywhere, federal, state, or other nutritional associations, as to what the bright line, unlike tobacco and alcohol, which are susceptible to a bright line, what is an acceptable, particularly candy, divisor between that and, say, an energy bar or a nutritional supplement or any of the other things that may have sugar in them and may have copious amounts of sugar in them, but are not specifically candy? Is there any kind of guidance for that you know of?
So, the states have adopted different, the states that have done healthy choice waivers or are in the process of implementing healthy choice waivers have used various definitions for soda and candy. I guess the answer is no.
Representative Kesselring.
Thank you, Mr. Chair, and thank you for taking my question. So I'm going to try to direct this specifically to what you said about SNAP. So it looks to me, just quickly in a search, to see the other 10 states that have tried to do this. It looks to me like that the department, or not the states themselves, but the federal government was the one that sent the notifications to the retailers. So in your experience, do you send information at all or communicate to retailers currently about anything else when it comes to food or anything else in general?
No, the department does not. It's between the federal government and the retailers. They have the agreements directly.
Follow
up.
So with that mindset, it sounds like the section in IV where the retailers participate in the SNAP program to state that line, and then also the subsequent section in the SNAP, by removing that would kind of alleviate the state having to do anything, and it would just be more specifically, with the federal government.
Yeah, yes, I think that's fair to say. The choices is really either to conduct this program and set it up through retailers specifically. That is how it is done now, so that the retailers really are responsible by their agreements with the federal government to code each particular food item individually as it's being SNAP eligible or not. That coding makes all the difference that determines whether or not the SNAP EBT card is used for that particular purchase. And then the final transaction amount and location is transmitted to the EBT vendor, who we work with at the state through DHHS to do the data match with the confirming the individual has a valid card, they're eligible, and the amount that's on their card to be used. So that's one way. And the ABT system would not have to be modified at all under that particular option. Otherwise, the EBT system right now does not transfer or collect any kind of data at the UPC level. They don't get a list of the items that are purchased right now. So they would have to change their system pretty extensively in order to receive the lists of each item purchased by a SNAP card in order to then determine if the item was eligible or not, and then follow up with auditing and monitoring of those particular activities.
Follow up?
Just to follow up. Sorry.
Sure.
Thank you for taking the follow up. So you're telling me that, because I'm seeing something different here, it says that there is classifications. You're telling me that there is in New Hampshire not a classification for each different item or category.
The classification is the items are either SNAP eligible or they're not. Mm-hmm.
Representative Weber.
Thank you, and thank you for taking my question. And again, if you're not the right people to ask this, just say so, because but my question turns to the issue of sweetened drinks, because we have been saying sodas. So am I right in thinking that, for example, a Diet Coke or a Diet Pepsi would not qualify because they would not have 5 grams or more of added sugar?
So it's my understanding that this is entirely up to states to determine what items should be qualified and what items would not be.
Follow up. Well, I'm just reading from the definition. So, and following on that, am I correct in assuming that at least some juice products might be disqualified as having more than the required amount of sugar and less than the required amount of juice for the definition?
Yes, I think that we would just need to be very clear on, with respect to ingredients, what constitutes the sweetened drink or candy, which the definitions here do provide for. It's not really clear to me right now if that's extensive enough for the federal government, given each and every single item. I've heard, when you talk about candy, and there may be somebody here who can speak more to this than I can, but when you talk about candy, I understand things like Twix bars, because it's made with flour, does not constitute the definition of candy. So it gets a little bit detailed and complicated. So I think that the definitions here, we may need to flush out in greater detail.
Thank you very much.
Thank you.
Other question, Representative Polozov.
Thank you, Mr. Chair, and thank you for taking my question. Yeah, you mentioned something about restrictions on hot food. So could you clarify how it's done? And is there still any way to use some existing systems allowing restrictions to include sweetened drinks?
So thank you for the question, if I understand correctly. So we could look at what other states have implemented and how they have defined their particular items, whether it's soda or sweetened drinks, what does that mean? I think there's a lot of detail there that we would want to be clear on. Otherwise, SNAP eligible food is essentially, as Attorney Clark was describing, is food for human consumption. It does not include alcohol or any kind of tobacco products. Anything else?
Follow up.
Thank you, Mr. Chair. My other question is about beginning of your testimony about promoting healthy food. So looking at fiscal note, how much we would save if we would remove this mandate to promote healthy food, and I wonder if there are some other groups inside DHHS that are already promoting healthy food. I know, like for families with young kids, I saw some communication about like eating fiber and vegetables and such. So I wonder if something like that already exists.
Yes, so the SNAP education program that was funded by the federal government really went beyond what currently exists today. I understand that there are some educational programs that are provided by the New Hampshire Food Bank. School systems may have their own programs through the New Hampshire Education Department, but the SNAP Ed program really went a bit beyond that. Educating specific SNAP eligible, whether they were receiving SNAP or not, they didn't have to. They just had to be eligible. And we would provide educational services and nutrition education to about 500 people every year and 100 community organizations. The food bank has about 400 plus partners statewide that they work with. So I could provide you with a link to their particular website. I'm sure that they have a lot more information about what those education programs entail.
Follow.
Thank you. And my final question, if you could help me just with like timeline. So on line 4, so on or before January 1st, 27, the submission of waiver. So how long would you expect that process to take? And could you remind me when exactly financial year 2029 starts? It's when you expect those expenditures.
Sure, thank you for the question. So we could submit the waiver within the 60 days as written in the bill. The federal government advises that states should plan 6 months from the time you submit before an approval is issued and implementation. Once implementation is issued, the state would need probably 6 to 9 months to make system changes if you're going to go by way of that option with the EBT vendor, contract amendments, and then implementation of those particular enhancements. So if that is the option selected, then we would recommend an effective date to implement the actual program to be June of 27. I note that the bill states that the department would issue a report November 1st of 26. There may not be a whole lot to report. We could certainly report that we've submitted the waiver and the status of it at that time, but that's probably the extent that we would be able to report.
Thank you so much.
Representative Weber.
And with respect to savings within the program, savings on food, am I correct in thinking there wouldn't be any because there is no difference in the benefit to the individual? There's only a difference on what they can spend it on. So the actual costs of the food in the program are not going to change.
That is correct.
Thank you.
Mm-hmm.
Representative Woods.
Thank you, Mr. Chair. Referring to the report about outcomes, you referred to some of the complexity, would you be able to, and I think you intimated that you require a interview with each one, and I can see where that would occur because just getting them not to buy candy with an EBT card doesn't mean they're not going to have candy. They may buy their steak with EBT and with some discretionary money still get the candy or from the kids next door. So that means you'd have to really drill down and get detailed dietary information from each person. Is that correct?
That is correct. The easiest way to accomplish that is probably by way of a survey to recipients as far as resources go. Otherwise, yes, the federal government is recommending that people be interviewed directly.
Anyone else? I actually have a question. You'd mentioned you'd need investigators involved in this if you worked with the retailers to enforce this, or?
If we went with the second option, that would require the changes at the EBT vendor level, so that they would be receiving the data specifically about purchases. In order for the department to monitor that activity and audit that activity, yes, we would need staff in order to do that with the number of retailers that exist.
So I'm just wondering, I know that if there's a violation in the program currently, New Hampshire is penalized, right? In the food stamp program? Or the SNAP program?
So retailer violations are done between the retailer and the Federal Nutrition Services. So New Hampshire wouldn't be responsible for if a retailer sells something that they shouldn't have sold.
Okay, good to know. Thank you. Anyone else? Any other questions? Representative Lucas.
Thank you, Mr. Chair. Thanks for taking my question. Should this be attempted at the retail level, in addition to the state needing the investigators, the additional staff, what's the impact on the retailer? Is there any way of knowing?
There are probably others here that could speak a bit more on than I can on the impacts to retailers, but I think that if it is the retailers that would be responsible for coding every single item, I think there's still some of that they would have to do, but to have them responsible for it would certainly be that's where the burden would shift, would be on the retailer.
Representative Palazzo.
Thank you, Mr. Chair, and thank you for taking my other question. Is there any information in the department about effect on public health? My understanding of the intention behind this bill is to limit somewhat sugar consumption and hopefully limit some diseases that might come from it, like obesity, diabetes, maybe high blood pressure and others. So is there any information in the department to what we can expect, and also how long would it take for us to see any like measurable effect? Would it be like waiting another decade to see some measurable success?
Thank you for that question. So I think that it would be, we would not be able to identify a direct causal connection between health outcomes and this particular program because we don't collect health data on SNAP recipients. So we wouldn't be able to measure that. However, there is probably data that we would consider using that is either collected by public health or otherwise that we could consider going forward to evaluate outcomes, but then how we may conclude its connection to this program, I think, will be difficult.
Okay, I'm seeing no other questions, so thank you.
Thank you.
Also signed up to speak is Kevin Daigle from the New Hampshire Grocers Association. You've asked for 5 minutes. If you could keep it short, more like 3, that'd be great.
Good morning, Mr. Chairman, members of the committee. For the record, my name is Kevin Daigle. I'm president of the New Hampshire Grocers Association. For those of you not familiar with our group, we represent both chain and independent grocery and convenience stores here in New Hampshire, all operating on razor-thin margins. I passed out some written testimony, and at your request, I'll try and keep my comments brief. We appear today in opposition. Our concerns with this bill focus on the costly compliance burdens for retailers, the reduced food access, the impacts on cross-border sales, and this bill just fails to improve diet or health. With these restrictions, retailers will be forced to overhaul systems for New Hampshire alone, with costly software changes, compliance upgrades, and employee retraining with costs estimated in the thousands for compliance. This is challenging for all, but even more so for the small independent grocer. This compliance is not a one-time issue. In fact, each time a new product or reformulation is introduced, these products have to be added by the retailer as either eligible or ineligible. With these compliance burdens, retailers will have to decide if they're going to invest the time and money into compliance or simply stop accepting SNAP. In those cases where they stop accepting SNAP, with limited options, food deserts will start to appear, where recipients now have to travel greater distances to find a retailer to accept their SNAP benefits. A SNAP restriction also threatens sales. So New Hampshire residents who would have their benefits restricted in the state can still use their SNAP benefits in a neighboring state without restrictions. That restriction only happens on the platform in the state that the ban is happening in. So on the flip side, out-of-state residents who flock to New Hampshire for cross-border sales can buy their products in their state, but not here, are going to stop crossing the border. When that happens, New Hampshire loses far more than grocery sales. It loses the ripple effect of economic activity that follows. Couple of points that were made when Ms. Hebert was up here. She had indicated that the states that had started already, so there were 5 states that started with the implementation date of January 1st. None of those states had a state-provided product restriction list. This was done on the retailer level, with anywhere from 40 to 100 hours a week being done initially to get those items listed as eligible or non-eligible. Thousands of dollars in compliance costs to change their POS systems, to upgrade their software to do that. And I think that answers your question, Representative Lucas. There was a study in your testimony that I passed out towards the back. The National Grocers Association and FMI authored a study through Timothy Richards called SNAP Restrictions Impact Analysis Report. It goes through to show you the various levels of compliance that different sized retailers have to go through, whether it's a small retailer, an independent, a large grocery, or a club type store. The percentage, the cost, the hours that are there. What it boils down to is an economic burden on retailers of approximately 1.9% of their net income. Let's keep in mind grocers and C-stores operate between 2 to 5% gross margin. For these many reasons, we ask you to find House Bill 1773 inexpedient to legislate. I thank you, and I'd be happy to answer any questions.
Okay, thank you. Representative Kesselring.
Thank you, Mr. Chair, and thank you for taking my question. So I have a question for you when it comes to the federal level changes that might come down. So I noticed that there's several bills that are in Congress that could do this. How would that affect you if it was the federal level? Because I've heard that the department doesn't communicate directly with the grocers the same way.
A federal level makes it an even playing field. Retailers who operate in New Hampshire and Vermont, Maine, Massachusetts, throughout, there's no patchwork of ordinances. They would much welcome one uniform thing. I don't have to update a system for New Hampshire and a separate system for that. So federal system would be welcome.
Just as a follow-up then, so I understand the amount of work that would need to be done, classification-wise for candy and soda and things like that, there is no distinction right now. I know that the language here matches what the National Sales Tax Association or whatever it is that puts out. That doesn't get done here in New Hampshire because we don't have a sales tax, or right. Just curious about that.
As far as the definitions for this, the state comes up with what those definitions are. And my understanding is when they submit the waiver to the federal government, that whole packet is included because they're going to want to know what is and is not included.
Let me just follow up with a clarifying question.
Yeah.
I'm talking specifically on the grocer side. There is no distinction currently in your, let's say, SKUs, your POS system. For that.
There are not. No, it's listed as grocery only at this point, so we'd have to implement non-eligible candy, non-eligible soda, and that brings into a whole other account, as Ms. Hebert had said. A rational person looking at the candy counter when you're in the checkout line sees peanut M&Ms, Reese's Pieces, Snickers, and Twix. To me, that's all candy. Twix is not considered candy under that definition.
Representative Hartnett.
Thank you, Mr. Chair. Thank you for taking my question. If I understand you correctly, so at a time when grocery costs are galloping, if implemented, the cost that you would, have to endure would then be passed on to just general shoppers through further increased costs.
Correct. Any of these costs would be downshifted down to the consumer.
Thank you.
Representative Palazzo.
Thank you, Mr. Chair. So you mentioned that one of the side effects of this legislation could be that some of your members will stop accepting SNAP. So do any of them currently not accepting SNAP, or do you have 100% acceptance?
No, there is not 100% of the retailers in the state that accept SNAP currently. That's a decision that they make on their own. As a aside, or I guess a preface to this, the Liquor Commission recently introduced mandatory tobacco reporting for retailers on a monthly basis. We had retailers actually get out of the business of selling tobacco because that was too onerous and time consuming and cost ineffective for them. So having to go through this exercise of the thousands of products that are on your shelves without any restricted product list to do that yourself, and then still risk the ability of getting fined and losing your SNAP permit, some will choose not to do that.
Representative Weber.
Thank you very much, and thank you for taking my question. As a resident of a border town, I live in Walpole over on the Connecticut River, where my town's grocery store, Shaw's Market, is the market of choice, not only for us, but from people from across the river where there isn't one. Would you expect, given your earlier comments, that Shaw's business will go down, both from Vermonters who will not come to their store and won't buy the other things as well, and people who live in Walpole who will cross the river for things that they want to buy that they can't buy here?
You are running that risk of losing those sales, yes.
Okay. Thank you.
Other questions? I'm seeing none. Okay, thank you.
I think, Jim.
Also signed up to speak is Robert Johnson II from the New Hampshire Farm Bureau.
Thank you, Mr. Chair and members of the committee. For the record, Rob Johnson, representing the Farm Bureau. New Hampshire Farm Bureau is a federation of New Hampshire's 10 county Farm Bureau organizations, consisting of about 1,300 family farm members and another close to 700 supporting members. And we are opposed to the bill as introduced. Our opposition lies in the definitions, bottom of page 2, where sweetened drink is defined, and on top of page 1 it reads that milk or milk products without flavoring, that without flavoring is a particular concern. As you're probably well aware, milk provides a host of essential nutrients. It's the number one source of protein, vitamin D, calcium, and potassium for children ages 2 to 18, and it provides over 20% of the calcium and 40% of the vitamin D in Americans' diets. And it represents a nutrient package not found in any other single food or beverage. And this is, that's why, and this has been recognized both with the ability to sell and provide unflavored and flavored milk with the recent passage of the Whole Milk for Healthy Kids Act in Congress. And that act now enables in our school lunch programs for both whole and reduced fat flavored and unflavored milk to be sold. Dating back to 2012,
whole milk and flavored milks were prohibited for being served at our school lunch, in our school lunch program. And when that went into effect in 2012, there was over a 75% reduction in the consumption of milk by our school children nationwide. And then I also would like to point out that the New Hampshire Interscholastic Athletic Association promotes chocolate milk as the, and I quote, official beverage of New Hampshire high school sports. And this goes against that. And in closing, I'd just like to point out, we also have concerns with, under the definition of candy, a product that is made of honey, fruits, and nuts would not qualify. And I thank you for attention. I'll leave it at that. Thank you, Mr. Chair.
Thank you. Any questions? Representative Kesselring.
Thank you, Mr. Chair, and thank you for taking my question. So it looks like you have the biggest issue with line 1, 2, and 3 of that section where it talks about milk, soy, and then the other one. Do you have an issue with the specific sweetened drinks line on line A, the way it's written?
We have no position further on the bill. Thank you. Thank you.
Anyone else? Seeing no one else, thank you. Also signed up to speak is Lisa Bodwin from the New Hampshire Council of Churches. Good morning.
Good morning. For the record, my name is Lisa Bodwin. I serve as the Executive Director of the New Hampshire Council of Churches. We are not here today to address the technical difficulties of implementation and the nuances in the bill. The New Hampshire Council of Churches opposes HB 1773 because it moves our state away from ensuring food security and dignity for families who rely on SNAP to meet their basic nutritional needs. Hunger and food insecurity are not solved through restriction and punishment, but through access, stability, and trust. SNAP is one of the most effective anti-hunger programs in the nation because it allows families to make food choices that reflect their circumstances, culture, and needs. I will also say it is very problematic to be framing personal choices and declaring what the government decides is appropriate as a personal choice and target only low-income families. HB 1773 would require the state to seek federal permission to prohibit certain foods, creating new barriers. It would add stigma and administrative complexity for people already navigating economic hardship. This approach does not increase access to healthy food. And while I don't have any numbers, I can tell you we have 300 churches across the state under 7 denominations, and food pantry use is significantly up since 2025. Instead, this bill is trying to shift responsibility onto individuals while ignoring the structural realities that shape food access, including high food prices, limited transportation, and even unavailability of nutritious options across communities. We call them colloquially food deserts. At its heart, this bill reflects a troubling shift from support to surveillance. Families who rely on SNAP are already working, they're caring for children, they are elders or people with disabilities, and I will add on a personal note, my son is a person with Down syndrome who works, lives in the community independently, and SNAP is a critical component to his ability to stay robustly integrated into the community. These folks are already making difficult trade-offs every day. Imposing restrictions on what they may purchase does not address their poverty or their health outcomes. It risks deepening shame, increasing confusion at the checkout line, and undermining the very purpose of SNAP as a nutrition assistance program grounded in dignity and respect. If our shared goal is better health, the evidence points towards strengthening benefits, expanding access to nutritious foods, supporting school meals, and addressing the root causes of food insecurity, not narrowing choices for people with the least power in the Granite State. Policies that single out low-income families for behavioral control do not reflect our values. That is not the Granite State way. Our state is committed to fairness and compassion. We must not confuse restriction with responsibility. HB 1773 does not strengthen families or communities, and it does not honor the dignity of those who rely on SNAP to put food on the table. We urge you to vote ITL on this bill, and I have two additions to my formal testimony.
Are they brief?
They are.
Okay.
As the previous speaker indicated, this may drive SNAP retailers out, and the Foundation for Government Accountability, the Florida nonprofit pushing these bills across multiple states through model legislation, is attempting to weaken the use of SNAP by harm through 1,000 small cuts, and this is the type of legislation that they are using as a tactic to restrict access to SNAP. And that is also not the New Hampshire or the Granite State way. Thank you very much.
Thank you. Any questions? Representative Palazzo.
Thank you, Mr. Chair, and thank you for taking my question. I think your testimony was about how important choice is and how restrictions are limiting this choice. So, understanding your opposition to restrictions in this bill, what's your position on current restrictions when we don't allow SNAP being used to purchase alcohol and other? Would you like to see?
No. No.
So those restrictions are fine, only like new restrictions?
Alcohol is not nutrition. There is a distinct difference. And alcohol does not provide calcium, protein, micronutrients, and other important parts of growing healthy bodies and brains for children, or maintaining the nutritional well-being of senior citizens.
Anyone else? Representative Drew.
What nutritional value is in that product?
Representative Drew, I really appreciate that question, and I am not a dietitian. It's not my subject matter area, so it would not be appropriate for me to comment on that product.
That's fine. Anyone else? Representative Hartnett.
Thank you for your testimony.
Thank you.
Okay. No one else has signed up to testify on this bill. Does anyone else wish to? I'm sorry? No, did you testify? Okay, all right. Okay.
Rather than sharing it, I apologize to you and to the commission.
Okay, that's fine. Does anyone else wish to testify on HB 1773 FN? Seeing no one, I'm going to close this public hearing, and we will be in recess until 11 a.m., at which time we will hear testimony on HB 1071. We stand in recess. Okay, I'd like to reconvene. It's a little after 11, and House Bill 1071 is now before us. And to introduce the bill, I'll recognize Representative Polazov.
Thank you, Mr. Chair. For the record, Yuri Polazov representing Maymark 10, towns of Hooksett and Dunbarton. I'm here to introduce House Bill 1071, repealing immunity afforded healthcare facilities when following directives are adopted in response to the COVID-19 state of emergency. The general idea behind this bill is that the state often finds itself impotent to do what it needs to be do. Sometimes the state directs certain private market or otherwise entities to act, and they're unable to act or too afraid to act, and then we have to resort to giving various immunities, legal immunities, which move process forward, but unfortunately interact negatively with our legal system and ability for our constituents to look for justice. We see it in many areas, like the only way we could introduce right to try was to give immunity, and we're looking into some police actions. We gave some immunity to police, and when we had this COVID-19 state of emergency on different levels, there were like different immunities being given away, and one of them on a state level on RSA 21P column 42-A still exists in our statute. Obviously the peak of emergency is over, pretty much emergency is over, so this immunity is no longer needed. So let's clean up and remove at least this immunity that is no longer needed. Thank you. I was not prepared for this testimony as like 1 minute before, but I will try to answer questions if there are some.
Oh, okay, thank you. Are there any questions? Representative Woods.
Thank you, and you may not. Thank you for Mr. Chair, and thanks for trying to answer my question. You may feel uncomfortable. I understand. And again, not being an attorney, the way I read this is that this is a retroactive action. In other words, any action taken under the section that this refers to would not be culpable for any untoward events. Or am I reading that incorrectly?
So I'm not a lawyer, and maybe it's something we need to ask a committee researcher to look into, but from previous discussions, I understand that it doesn't change anything retroactively. It's just like proactive, forward-looking removal of immunity.
Representative Weber.
Thank you, Mr. Chairman. I actually have a question for you, which is, do you suppose our committee researcher could look into the question of whether the statute of limitations for actions that happened during the COVID state of emergency has expired? Because it appears to me that if we remove this section and the statute of limitations has not expired, we are allowing people to sue entities that were required by governor's proclamation to do things, to be sued for doing things that they were ordered to do. And that would be unfortunate. If it's no longer needed, that's one thing, but maybe our researcher could find out for us if there would be consequences that are perhaps unintended
Okay,
or
thank-
perhaps intended.
Sure. Mrs. Grant, do you have all of that? Okay, great.
It really is a tough question. We were going at it.
Thank you. Any other questions for Representative Palazzo?
So if I may comment,
Sure.
I'm not opposed to researcher looking into this, but my understanding of bill as written and the way our legal system works, it won't have a retroactive effect if we remove this immunity at some point in the future.
So, Representative Palazzo, it sounds like this possibly, and I know we don't like this term, but this could be just a housekeeping bill. Is that possibly what the thought is, that the COVID state of emergency is now gone and therefore we don't need this? Is that what your interpretation is? Or
I would need to look more into it, but I think it might be more. There are still measures going on, like, and just like a couple of months ago we saw like some other jurisdictions bringing masking again for COVID again, and also like we saw our state moving from not recommending COVID vaccines for children because they're not as accessible to, they're not so vulnerable to this disease, to going back to going now with AAP recommended vaccination schedule that now includes COVID-19 vaccines again. So I think we might, even though like the peak of like COVID pandemic and COVID-19 state of emergency actions are over, I think we are still experiencing some of those actions. So maybe even though it's not retroactive, maybe it will affect something that is still happening.
thank you. Representative Weber.
Are you aware that the statute as written is specifically limited only to those things that happened under an emergency order with respect to COVID-19 and do not cover anything subsequent?
I would point out that the prime sponsor just came in, Representative Palazzo. I don't know if you want to answer that question or relinquish the chair to him. But
Yeah. I'm happy to give the chair.
Good morning, Representative Mannion. Welcome.
Sorry, I thought it was at 11:30. For the record, my name is Tom Mannion. I'm the prime sponsor of 1071. I'm representing Hillsborough 1 and Pelham. So yes, the purpose of this bill here is we're repealing an immunity that was afforded during the COVID-19 pandemic. To me, we should not be affording immunity to anything that results in life or loss of life or injury to anybody. And I'm not a fan of the I'm just following orders excuse. I don't think that's ever been tolerated, and especially when it comes from a government mandate. So with that, I'd like to take any questions.
So are you saying this would be retroactive to that period if somebody had done something wrong, or just moving forward? Or
well, if it repeals the immunity, I would say it's retroactive. Immunity that exists in statute right now seems to be in perpetuity. It's there for as long as it's in statute.
I see. Representative Weber.
So I will ask the question again that I was asking of Representative Palazzo. Are you aware that the immunity that we are talking about is limited specifically by the statutory language to actions that happened under the state of emergency with respect to the novel COVID virus, and is not limiting any other kinds of immunity?
Yes, I understand that that's the purpose of this statute. I don't believe that it doesn't matter what or when or why that these immunities come into being, like what's happening in the state. I don't believe that we should be granting blanket immunity under any circumstance. It doesn't justify, like, if we have a loss of life, or injury that is caused by these organizations, I don't think that there's any type of emergency that justifies that.
Follow up.
Follow up.
So you would oppose any limitation on liability in other areas, such as the ones we have seen, either with having to do with healthcare treatments at the end of life, or healthcare treatments to develop novel treatments where we are encouraging people to take those actions by limiting liability? You would oppose those?
If I waive it, I support an individual's right to waive any, for example, like experimental treatments or something like that. If I wanted to opt in, that is up to me to decide. But if something was subjected upon me, I don't believe that there should be liability protection in those circumstances.
Representative Lucas.
In that situation, if the provider of that experimental treatment carries insurance, and the insurance company learns that immunity is not available, what do you think that insurance company might do in that situation?
I can't speak to how an insurance company would react to a situation like that. I would say that any type of experimental treatment should always be opt-in. I don't think anything should be forced upon anybody, and I don't think any like even vaccine manufacturers, whatever it may be, should be granted just blanket immunity because it's for the greater good, so to speak, or any type of state of emergency type situation.
Thank you.
Any other questions? Representative Kesselring.
Thank you, Mr. Chair, and thank you for taking my question. So I do see before you got here there was a little bit back and forth about this blanket immunity thing, obviously. Would you be opposed to adding in a start date for this to repeal and not cover from previous?
Sure. I think we're long past the point where this mattered anyway. It'd be better. I much prefer that it should there have been life lost due to just state of emergency. I still don't believe that I was just following orders is justification, in my opinion. If this is a middle ground, I'm always happy to work towards the middle.
Other questions? Seeing none. Thank you.
Sorry. My apologies for being late.
Thank you. Also signed up to speak is David Ross from the New Hampshire Association of Counties.
Good morning, Mr. Chair and members of the committee. Thank you so much for allowing me to come and speak to you today. My name is David Ross, and I am the administrator of Hillsborough County Nursing Home. I am here today on behalf of the New Hampshire Association of Counties. The Association of Counties respectfully opposes House Bill 1071, which repeals the immunity afforded to healthcare facilities when following regulatory directives adopted in response to the COVID-19 state of emergency. The New Hampshire counties operate the state's 11 county nursing homes and caring for some of the state's most fragile, elderly, and vulnerable residents. During the COVID-19 state of emergency, our facilities were on the front line of an unprecedented health crisis. County homes implemented rapidly evolving state and federal directives regarding infection control, visitation restrictions, cohorting of residents, staffing protocols, testing and vaccination requirements, all in an effort to protect residents and staff. The limited immunity provided under current law recognizes the extraordinary and often chaotic conditions under which our facilities were required to operate. County nursing homes did not act independently or arbitrarily, and they acted in good faith on binding guidance and emergency orders issued by state and federal regulations. Administrators were required to make immediate operational decisions based on directives that changed as scientific understanding of the virus evolved. It is important to note that the existing immunity granted to healthcare facilities does not protect reckless or intentional misconduct. It provides protection only when facilities followed it in accordance with official emergency directives. Removing this protection would unfairly subject county nursing homes to litigation risk, for following the very rules that they were legally required to implement. Repealing this immunity would expose county nursing homes and, by extension, county taxpayers to significant legal and financial risk for actions taken in compliance with government mandates during a declared emergency. Counties operate nursing homes as a public service, not as a for-profit enterprise. Any increase in liability exposure would directly impact local property taxpayers and could strain the financial stability of the facilities that already operate within tight margins. New Hampshire County nursing homes answered the call during one of the most challenging periods in modern public health history. The limited immunity in current law appropriately acknowledges these extraordinary circumstances and the good faith efforts made to safeguard our vulnerable residents. I'm happy to take any questions that you may have.
Thank you. Any questions? I'm seeing no questions. Okay, thank you.
Thank you. I'll provide the written testimony. Thank you.
Okay, thank you. No one else has signed up to testify on HB 1071. Would anyone else like to testify? Seeing no one, I am going to close the public hearing on HB 1071. Our next hearing is scheduled for 1 p.m., at which time we will hear 1706 FN. Until then, we will be in recess. Good afternoon, everyone, and welcome to the House Committee on Health, Human Services, and Elderly Affairs. As you know, we have a hearing that we're about to begin on HB 1706 FN. And just to explain how we do things here in the committee, I'll be recognizing the prime sponsor in a moment to introduce the bill and explain the background of the bill, why he's introducing it. And we do give this prime sponsor a little extra time to do that. After that, in order to make sure that everybody has an equal chance to testify and also to give committee members a chance to ask questions, we do limit testimony strictly to 3 minutes, and we will have to insist that you limit your testimony to 3 minutes. I will ask you to stop at the end of your 3 minutes, regardless of where you are in your testimony. At that point, I'll ask for, if you're going to entertain questions, and certainly if you're willing to do so, the committee may have some, and we'll be happy to hear more from you. But that's what we'll need to do if we're going to be able to accommodate everyone this afternoon. I know this is a very important issue, and we do want to be respectful and accommodating as much as we can. So with that, I will recognize the prime sponsor, Representative Corcoran, and please tell us about the bill.
Thank you, members of the committee. Red is what I want to speak.
Yes, you do.
Okay, great.
Yes, you do.
So first, just 10 seconds of review. The New Hampshire Department of Health and Human Services oversees the state's refugee resettlement program. The program is 100% federally funded, and the stated goal is to help refugees achieve economic self-sufficiency and successful integration within 5 years of arrival. There is zero evidence to suggest that this program works, and huge amounts of evidence suggest that it does not, and that it burdens New Hampshire citizens with dozens of different costs, including, but not limited to, welfare payments, unemployment payments, increased school spending, social fragmentation, crime, cultural conflicts between heritage Americans and refugees, and also between refugees of different ethnicities, increased rates of communicable disease, a housing crisis, and population replacement. Who benefits? Much testimony against this bill will argue that the refugee resettlement program is good for the people that it serves, the refugees. My response is simple: I don't care. Lots of things might be good for Somalis or Haitians or Bhutanese, but the government of the state of New Hampshire does not exist for the benefit of Somalis or Haitians or Bhutanese. It exists for the benefit of citizens of New Hampshire. The relevant question is, does the refugee program benefit New Hampshire citizens? My answer is no, and more specifically, that the program is actively very bad for the citizens of New Hampshire. For that reason, we should end it immediately. And most of the rest of the testimony is details of that. I've submitted written testimony on every factual claim I make. I've tried to make the claims numeric and quantitative, and I've provided cites to studies and data sets supporting the claims. First, let's talk a little bit about what refugee means. Any person who is unable or unwilling to return to their country because of persecution. This is from 8 U.S.C. 1101. Does this mean that everyone that the refugee program settles in New Hampshire is a legitimate refugee? No, because no evidence is required to be placed as a refugee. The law itself says, quote, the testimony of the applicant may be sufficient to sustain the burden of proof without corroboration. Do we have any evidence that economic migrants who are here to use welfare and other programs lie to achieve refugee status? Absolutely we do. NPR itself has said, immigration officials are moving against immigrants in a sweeping review that is related to an investigation into asylum mills. During the probe, prosecutors rounded up 30 immigration lawyers who helped immigrants fraudulently obtain asylum in Manhattan's Chinatown and Flushing, Queens. This was dubbed Operation Fiction Writer. Basically, it is reasonable for a refugee to say, oh, I escaped from this place. Obviously, I don't have my papers. Obviously, I can't provide proof that the police there were corrupt. Why would the police in China or Rwanda or whatever provide documentation that they're actively corrupt? But let me tell you my story. The problem is that these claims are cookie cutter, and because on the one hand it's plausible that you might not have documentation, the fact that you walk in without any documentation and you've got a carefully written script is in fact sufficient. It creates a rebuttable presumption that all of the claims are true. So let's talk about the pictures of typical refugees that are settled in New Hampshire. And now, if I were to cite these statistics and say this is from the arrogant right-wing anti-refugee foundation, you would say, well, sure, these guys are in the business of creating these statistics. So I want to play this on hard mode. Everything that I cite is going to be from pro-refugee academics in a report at UNH. According to the pro-refugee academics, 14.5% of refugees settled in New Hampshire have zero education, and 62% have not graduated high school. 33% have no English, 51% have no or very poor English. 25% are unemployed. Of those who do work, most are not working full-time, and they are low-wage earners. What are their goals? Most refugees hope and plan for chain migration. And there are a bunch of quotes in the report from refugees about this. Quote, "The highest thing I can think of is to try to bring some of my family people here." If you ask them to list their top 3 goals, one of them is bringing family to the U.S. Now let's talk about culture and assimilation. There's a lot of discussion that, hey, we've had immigration before. The English were here first, and then Germans came over. And, then Swedes came over, and Irish came over. And these are all very similar Northwestern European cultures that have a lot of shared history and shared norms, similar religions, lots of interlocking political situations. The pro-refugee report talks about some of the problems that refugees have. They complain that they are not allowed to congregate and drink in public, that it is against the laws here because it's illegal where they come from. They are upset that there are child abuse laws because they believe that corporal punishment for lack of respect to elders is appropriate. There is ingratitude. They complain that there are not more resources. There is clannishness and lack of assimilation. Migrants group together with the same nationality. But the question of community is complicated because of the existing divisions that refugees bring with them from their home countries, related intra-refugee ethnic tensions. And we see the more our foreign-born population climbs, the more that this is reflected in our local politics. There's the phrase, import the third world, import the third world's ethnic and political grievances. And we had a big wave of refugees from Bhutan, and now we have legislation before the New Hampshire House asking us to take sides in Bhutanese internal politics. The city of Manchester had a big experience with refugees. This was 20 years ago, and things got really out of control, and they released a 20-page report, and there is a link to it in the submitted testimony. The city was forced to develop 596 different language versions of forms and documents. Accentria, which is a group that we'll be hearing from today, they're very pro-refugee, placed 16 refugees in a 3-bedroom apartment. Because the refugees are unskilled, they were exceedingly poor, earning $7.78 an hour. Inflation adjusted, that's $15 an hour now. This is not enough to allow them to live in a reasonable way. City schools were forced to handle over 2,000 English learners. Refugees had infectious diseases including tuberculosis, HIV, Hep B, syphilis, giardia, malaria, and other communicable diseases. The city was on the hook for paying interpreters $45 an hour, which is inflation adjusted $90. Now, there are a lot of organizations that exist to settle refugees here, and they do most of their work on getting them here. The city of Manchester itself, in their report, complained that there was no ongoing support to help the city deal with it. So, the organizations, they get their paycheck, they drop the refugees off, and then it becomes someone else's problem. So, there's a lot of debate and the assertion in a related topic, illegal immigrants. And to be clear, we're not talking about illegal immigrants today, but I'm sure that you have all heard illegal immigrants are not allowed to use welfare programs. That is a questionable assertion, but refugees absolutely are. I'm going to talk about some of the programs that they are allowed to use. Community food pantries, 33% of refugees use them. SNAP and EBT, 36.8 are currently on SNAP or EBT, which is including those who have been on, over 50%. Section 8 housing, over 27%. Medicaid, 63%. Public housing, 15%. WIC / food stamps, 53% currently on, 42% previously on, for a total of 95.8% of refugees on WIC food stamps. Refugee cash assistance, temporary assistance for needy families, supplemental nutrition assistance program. This is up to $1,183 per month, and there's no lifetime limit. So the lifetime value for a family can be $500,000. Refugee medical assistance, refugee social services, Job Corps, at a cost of $187,000 per applicant. Workforce Innovation and Opportunity Act programs. Head Start. Head Start costs about $21,000 per year per child. For 3 years, average refugee has 2.5 children, so there's $122,000 per family for, that's early Head Start from age 0 to 3. Head Start itself from age 3 to 5 is another $97,000 per family. Earned Income Tax Credit. This is a welfare program administered by the IRS. Now, earned is a word. It has no actual meaning here. You can get $10 in salary, apply to the IRS, and the IRS will say, oh, we need to refund some of that over-tax payment you made. Here's a check for $20,000. Child tax credit, another program administered through the IRS. Lifetime value of $80,000 per family. There's second-order welfare, the NGOs, and we'll hear from them today. They are very much in favor of current programs because, not to mince words, they're getting rich off of these programs. There has been testimony submitted from, I think, the New Hampshire Immigrant Rights Network. This is a sort of meta NGO comprised of dozens of other NGOs, some of the constituent NGOs. USA Hello, $1 million a year budget from tax dollars. Granite State Organizing, $1 million. International Institute, $17.5 million, and the CEO earns $250,000 a year. National Immigration Law Center, $24 million. All of the execs earn over $300,000 a year. American Friends, etc. It goes on. Catholic Charities, $45 million a year. The CEO earns $400,000 a year. A Century Care Alliance is a network of 12 different NGOs, all with the same staff, and they are all peer-to-peer. They each have budgets from tax dollars of $9 to $10 million a year, and they all have the CEO, same CEO, Angela Beauville, who makes $400,000 a year from one or more of these. So when those folks testify after this, ask yourself, maybe even ask them, what is your CEO's salary when each of them testifies? Let's talk about school cost to towns. Schools in New Hampshire cost $21,000 a year. $17,000 of this is from local taxpayers, $4,000 is from the state. So every refugee family with 2.4 children is imposing those costs. But most of these students, something like 51% of refugees have poor or no English skill, so they are classified as ELs, English learners, and get ESL classes. It's very hard to get data on exactly how much ESL costs, but I do have a site, and the suggestion is that it might be on the order of $60,000 per student per year. So for each family, you're looking at something like $150,000 per year for ESL. Now, indirect costs. We've heard a lot about the housing crisis, and I take all of my figures here from the housing activists who say there is a housing crisis, and they say that we are short of 23,000 housing units in New Hampshire. There are somewhere between 5,000 and 8,000 refugees in New Hampshire. I've got two different sites. One is from the Department of Health and Human Services, and there's a URL. They say 5,157. But the Refugee Admissions Program in New Hampshire URL claimed that there were more than 7,500. They have scrubbed their webpage of that, so I've got an archived version. I don't know exactly when the page was changed. At 3 refugees per housing unit, it turns out that refugees in New Hampshire cause about 10% of the total housing shortage. I'm moving quite quickly. I'll wrap it up in about 3 more pages. Indirect costs, crime. In general, immigrants and their descendants in America have crime rates similar to their home countries. Sweden has a lower crime rate than Italy does, and Swedish Americans have a lower crime rate than do Italian Americans. New Hampshire, and this applies for all sorts of other programs. If we look at any given country, descendants of that group in the U.S. have crime rates that reflect their violent crime rates in their home countries. New Hampshire's refugee program does not recruit Swedes and Irish and English. It is heavily slanted towards bringing in migrants from Africa, 40% of all admittees. Europe is only 8%, and South America is 0.07%. Unfortunately, Africa has the highest violent crime rate in the world, and we see that in local statistics. I did an RSA 91A request for Manchester and asked them about their arrests and the country of birth of the people that they're arrested, and you get exactly the ratios that you might expect. And this leads us to see headlines like one at Patch.com. Regis Babu Irumva escaped felony, burglary, and sexual assault charges due to plea bargains. During the past 4 years, he has been arrested or summoned in 32 criminal cases in Concord. According to court records, he has been previously charged with felonious sexual assault, indecent exposure, gross lewdness, burglary, domestic violence, criminal threat, disobeying an officer, disorderly conduct, driving after revocation, simple assault, criminal threatening, criminal mischief, theft, receiving stolen property, DUI, resisting arrest, breach of bail. It goes on and on. Now, I'm certainly not saying that every refugee commits any crime at all. Many of them don't, but it's certainly true that when we are doing the sort of demographic replacement that the refugee program is very explicitly targeted on, that we do get the downstream results of that. And we've seen overseas that England, France, Germany are all suffering from the effects of their refugee admissions process, and so is New Hampshire. Thankfully, our numbers have been very, very low, so we haven't seen a lot of this. Another indirect cost is displacing American citizens from loans and government programs. It is the official policy of the United States government to discriminate against citizens, whites, men, and heterosexuals in various government programs. This is codified in USC 13, Chapter 1, Part 124.103b1. There is a rebuttable presumption that individuals that are socially disadvantaged, if they are black, Hispanic, and it goes down the list. And you can guess, from Micronesia, from Africa, from India, from Pakistan. And C, at least one objective distinguishing feature that has contributed to social disadvantage, such as race, ethnic origin, gender, or a history of being socially isolated. So I'll cut short the definition. But basically, if you have refugee status, then it is the official United States policy that you qualify for this and you leap to the front of the line for SBA loans. We've heard a lot about this recently, for government contracting. So, if anyone in this room or listening at home has a thought of, hey, I'd like to set up a small machine shop. I'd like to get a loan for that. I'd like to see if I can sell parts to the U.S. Air Force. Be aware that if you are an American and or white and or male, then according to official law, any refugee who is here has to jump to line ahead of you.
You could start wrapping up, please.
Absolutely. Indirect costs, social trust. The New York Times has reported on the downsides of diversity, increased crime, lower friendship, a lot of stuff. There is a great report linked, and the New York Times is hardly the National Review or some other right-wing outlet. And let's see, you're going to hear from the New Hampshire Immigrants' Rights Network. They have a position paper, and I checked each of the footnotes. And I have problems with all of the footnotes. Footnote 4 notes that, well, you know what, I'll skip it. I'll let them present their case.
Yeah, let them testify
Absolutely.
for themselves.
So I will skip over all of the rest. The sites are there for those who want to read them, but I just want to circle back to the thesis statement. New Hampshire government exists for the benefit of its citizens. That's, in any thesis of why government exists. It is absolutely true that we could do things for other people, and anyone who is a New Hampshire citizen and wants to, contribute to charities that help those overseas is absolutely free to do so. The negative effects of bringing foreigners here, many of whom are quite plausibly falsifying their claims, and the absolute huge impact that they have on citizens with per refugee negative financial impacts of over $500,000 lifetime value per person, plus increased crime and social distrust, is such that it is an affirmative desire for us to have a refugee program. So we don't merely have to say, hey, it's sitting there, why not keep continuing it? I would argue we have to say, is this good? Is this what we want? I see no evidence that it is, and outstanding mountains of evidence that it is not, and I'm happy to answer any questions.
Any questions? Representative Kesselring.
Thank you, Mr. Chair, and thank you for taking my question. So I'm going to start off with the hardest part about this whole bill and what it talks about. Obviously, it says it's going to be a deduction of $4.4 million. Again, we haven't heard from the department yet and all that, but I'm going to ask you, based on the way that this is written, it looks to me like it's going to create a huge amount of cost in the state because of there's no step down. It immediately says the department shall not take any more funding from the federal government. So could you talk me through how much money that's going to cost the state or how you envision this working?
It also says that the state shall take no actions and that the department shall be dissolved. So, if your argument is, hey, these people would like to have their jobs, they would like to keep resettling refugees, I would say absolutely this bill tells them that these jobs no longer exist. Now, there might be other jobs in New Hampshire state government for them to have, but I read an analogy once that there, might be great employment if we paid people to cut down, sequoia trees or giant, the name escapes me, old growth forests. But just because it would employ people doesn't mean that it's socially beneficial. I think that we have a program that is massively socially detrimental, and every day that it goes on, we increase cost to taxpayers, we increase social costs, we increase crime, so the sooner we end it, the better.
Well,
I guess let's just focus on in here because you've done a lot of research just to make sure that I understand this. So the department obviously is, again, I guess we got to hear from the department, how it's funded. Where is the other programs and other costs, let's say, is there any specific things that you think we should be looking at that might be an issue? Let's just put it that way.
I'm happy to answer the question. I'm not sure I quite follow. So my understanding of the way that the bill is written is that in something like 60 days after passage, the department would cease to exist. And the duties that it takes on would cease to be duties.
Anyone else? Representative Tejas.
Thank you, Mr. Chair, and thank you for taking my question. So I'd appreciate a clarification. When you started speaking, you referred to the refugee resettlement program.
Yes.
This bill is about the state refugee
Yes.
program, which is not the same thing. Can
Right.
you
So there is a federal program, and what the federal program does, it sort of doesn't touch things directly. It mostly hands out money to the states and says, hey, we'd love for you to do 2 or 3 or 5% of all refugee resettlement. And then the state has employees on the payroll. And then this is sort of a second layer of pass-through. The state does almost nothing directly. What the state does is then lets out contracts with, for example, the 12 different Essentria NGOs and says to them, hey, why don't you go contact the State Department? Why don't you get from them a list of people who might want to live in New Hampshire and tell us how many you get, and we'll cut a check to you. I'm not sure. So what this does, this bill, obviously, it does not change federal law. It does not disestablish the federal program, but it says that one less state has a state level organization that interacts with this federal program.
Okay, so just to clarify, the state refugee program does not bring refugees here, does not resettle people. This is about federal funding exclusively that supports people who are already here. So I just want to make sure we're on the same page.
So I'm going to try to answer that question. The state of New Hampshire does not find candidates overseas. It does not speak to them in embassies. It does not give them airline flights to the United States. What the state program does is interact with the federal State Department's program of the Office of Refugee Resettlement. And it says, do you have an Excel sheet of people that you want to send to New Hampshire this month? The State Department says yes, emails the Excel sheet, and also sends along a check for $400,000 for this month. Our New Hampshire State Department takes that spreadsheet, takes that check, then picks up the phone, contacts Essentria Care Network and all of the other NGOs that you're about to hear, and says, hey, we've got people who will be arriving on a bus in a week or two. Why don't you meet them at the bus station, help them sign up for welfare, help them sign up for local schools, help them sign all for this, get them a box of kitchen utensils, get them some clothing, etc. And so my understanding is that the state mostly just acts as a conduit between federal money and federal lists of refugees and in-state NGOs.
Can I follow up?
Follow up.
Just to clarify, the state does actually not play that role. That the relationship between the feds and the resettlement is directly with the NGOs, and the state has no role in resettlement. So
Okay.
that's just a clarification.
That was not my understanding based on documents that I read at the Department of Health and Human Services website.
And one additional question.
One
Yeah.
more.
I was very confused by how you described who is being let in through the program, because my understanding is there's a very intensive 18 to 36 month vetting process involving multiple federal agencies abroad before people are even selected to come here. So how does that mesh with what you
That
shared?
is in fact the claim. And the Immigrants' Rights Network has a position paper which I read, and they made that claim in their position paper, and it had a footnote, and that footnote led me to the Urban League, and they had a position paper, and they made that claim, and they had a footnote, and I followed that footnote, and the claim sort of disappeared in the mist. That is rigorous, and that it takes a long time. There was a second footnote in one of these documents, and I believe it was from the Hebrew Immigration Society or something, or HIA, I forget the details, and they were actually saying, oh no, there are proposals that we will get a rigorous vetting process, and that would be catastrophic. It would, quote, decimate the refugee program. So it is absolutely a talking point that NGOs use, that refugees are very well vetted. But again, I cited, and I can cite again, 8 CFR 1208.13, the testimony of the applicant can be sufficient. It creates a rebuttable presumption. So if someone else comes and says, hey, I just saw you talking to my cousin Joe, he's trying to be a refugee, he's a liar. He was in the death squads, he wasn't hunted by the death squads. Then perhaps that presumption would be rebutted with additional evidence. But the claim itself is absolutely sufficient to establish their status.
Okay, I'm seeing no other questions. Thank you.
Thank you for your time.
Also signed up to speak are John Williams and Laura McGlasham from the Department of Health and Human Services.
Chairman McDonald and members of the Health, Human Services, and Elderly Affairs Committee, good afternoon. For the record, my name is John Williams. I'm the Director of Legislative Affairs with the New Hampshire Department of Health and Services, and with me today is...
Good afternoon. My name is Laura McGlasham. I am the New Hampshire State Refugee Program Manager for Department of Health and Human Services.
And the department does appear before you with serious concerns relative to HB 1706. I think that the committee certainly asked some very pointed questions that I think were pretty helpful, starting off with Representative Kesselring. The economic impact that would be had with the passage of this legislation, as you can see from the fiscal analysis, would be over $4 million in lost federal funding and federal grants. And I'd also state that that would be loss in revenue beginning in state fiscal years 27 all the way through state fiscal years 29. The state of New Hampshire prides itself in having control over the administration of these funds, and if this legislation were passed, it would not end the federal program. Federal preemption would certainly control, and that the refugees would still be coming here to New Hampshire. It just would be managed by the non-governmental organizations that are out there who do incredibly good work, by the way. However, one of the significant limitations that's not reflected in the fiscal note and has not been asked is that there's a specific grant that the department is entitled to manage, and it's called the Refugee Support Services Grant. On average, it's over $1 million. That particular grant is not available to the states that elect not to have a state-run program, but rather relying upon non-government entities. So just for a clear understanding, the economic impact isn't just a loss in the $4.4 million in the lost revenues and reductions in state expenditures, but rather it would be a loss to the community, to local and municipal governments, over $1 million per state fiscal year. So if the bill were passed, it would have a negative impact in terms of at least the financial impact of this legislation to New Hampshire citizens. And I hope that I spoke clearly enough to make that understood, that this particular grant is allowed to be managed by Ms. McGlasham and the department itself, but it is not allowed to be managed at the NGO or the non-government organization level. Our agency leverages significant resources. So from a business model perspective, we do an incredibly good job in terms of leveraging those resources with 2 dedicated staff who are 100% federally funded. And again, I just want to make a note that the monies that we're talking about here are not state general fund dollars, but rather completely federal dollars that we're discussing. I also want to bring to your attention that this committee heard a very similar bill back in 2023. That was a bill brought by very honorable Representative Jess Edwards. He himself at the hearing on his bill, and that was House Bill 1347, acknowledged some of the deficiencies in his own legislation. So you can go back to the recording and hear exactly what he said around the legislation. This committee then retained the bill and then eventually voted to put it into interim study. They thought it was at least worthwhile to study the bill. Now that underlying bill prevented the use of any of the dollars from the refugee resettlement, all these federal funds, unless the department could demonstrate that all of New Hampshire's U.S. citizens received all the social determinants of health and those resources that are out there. I would say constructively, that bill would result in repeal of the state's refugee resettlement program in the same way that constructively this bill would do as well. As you can see from sections 1 of the bill, it identifies the limitations that Representative Kesselring clearly identified, which is that we'd be prevented from receiving money and or contracting as a provision of section 1 of the bill. There is a 60-day lapse period. Even if we work with the most efficiency in the world, there would still be a lapse of 60 days before you could have non-government organizations set up to administer these programs in the state. I would just represent to you from a business model perspective that doesn't make a lot of sense. Some would even say that it was pound foolish, and I'm just going to leave that particular commentary around that. So with that said, and just going back to the interim study bill, this committee voted 14-1 on Halloween of 2024 that it would not, they recommended not, and I repeat, not for future legislation. So with the historical precedence of testimony, but I am going to ask Ms. McLaughlin, because she's actually the brilliant person who works in that particular program and does an incredible job helping sustain the important benefits of this particular program, and also helping individuals to achieve their goal of U.S. citizenship here in the United States. So, Ms. McLaughlin?
Thank you, Mr. Williams. And to the committee, I just want to emphasize that if the state were to no longer administer the refugee program, it would not stop refugees from coming to New Hampshire, as Mr. Williams described. And furthermore, that we would lose a significant amount of funding to support those refugees because those funds can no longer, they can only go to states. Thank you.
Okay, thank you. Any questions? Representative Weber.
Thank you, Mr. Chairman. Thank you so much for taking my question. So as a follow-up to that last statement, if the bill gets passed, we don't have the funding for support. But what happens to the refugees?
And Chairman McDonald, I will take that as would you believe question. So yeah, we would clearly see that there would be an impact to the state of New Hampshire as a result of it, and the downshifting of costs to other entities, whether they're faith-based community supports for those programs, that somebody would have to pick up those particular costs associated with that resettlement program within the state. So I will take back my would you believe commentary.
Representative Hartnett, and then Representative Kesselman.
Thank you, Mr. Chair. Thank you for taking the question. The sponsor of the bill painted a pretty bleak picture for this program. Could you share, you're the manager of the program, could you share what you think the program does, in fact, do?
And Chairman McDonald, we're just making it very clear, we respect all the presenters who come before this committee, and we certainly do respect the legislature, but we can talk about what positive work is being done by the unit, by that, just by virtue of her own basis of knowledge of the program itself, if that's helpful.
Yeah.
Sure. So the funds that we contract out to 4 organizations which provide refugee support services, the primary goal of that, as well as the federal program, is to provide the supports needed so that the clients achieve economic self-sufficiency at the earliest possible date from their arrival. This secondary and equally important would be that they achieve successful social integration. And I think the entities themselves can probably best speak to some of the statements that were made previously.
Representative Kesselring, and then Representative Palazzo.
Thank you, Mr. Chair. Thank you for taking my question. So you mentioned the fiscal note, which I talked about. I do have a concern, and I'm hoping you can explain it to me. So the $1.7 million that's slated here talks about that it's not just resettlement. The department said that it's rather for access to deaf, hearing loss, vision, speech, and other impairments. How is that connected to this?
So as part of the fiscal analysis, the LBA took the department's work product and then screened it to make sure that it was absolutely as accurate as it possibly could be. And you'll note here that we've identified that there are several grant programs that are administered by the department through this. We wanted to identify, just for complete transparency, that there is a program that deals with the deaf and the hard of hearing that we wanted to acknowledge is out there, but we did not feel that it was part of this particular fiscal analysis. So the overall cost of the $4.4 million, to my understanding, does not include that additional fund that is slotted for the individual with the deaf and hard of hearing, which does have a mix between federal and state dollars associated with it. Am I close? Yes. I hang out with a lot of financial folks.
Follow up.
Thank you. Thank you for the follow-up. So with that, none of the grant funds that we currently get, because you mentioned another grant, are that through this program, are they utilized for other things than what the resettlement is for, specific programming?
Right. Let's see. So, yes, we're bound, I mean, by the Federal Office of Refugee Resettlement to utilize the funds for refugee resettlement.
What's that?
Just
one more. Okay.
Okay.
I take it that Representative Kesselring wanted more specificity around the types of program, and we are prepared to respond to that.
All set? I wasn't sure if they were going to send you
Oh, I
something.
see. Right. Okay.
Say it
Sorry.
now.
So yes. So the funds that are used to fund both my position as well as I have a colleague, one other staff member that helps. We make sure to comply with the federal regulations that govern the program. We oversee the contracts to the organizations. Yes, that comes with the monitoring to ensure compliance and.
Go ahead.
Just to clarify, so that extra grants fund those positions on top of this, or is it part of that funding?
The two refugee program positions are 100% federally funded. It's yeah.
Representative Palazzo.
Thank you, Mr. Chair, and thank you for being here to answer questions. Could you help me with understanding how this resettlement happens in terms of physical move of people? Like, is it federal government who decide what state and what city or municipality people come to, and if they're like bound to that municipality for any amount of time, or if they immediately allowed to leave and go? And second part, we heard two numbers, about 5,000 and about 7,000. So do I understand correctly? So that 7,000 refugees were admitted, but only 5,000 left in New Hampshire, or like what are your numbers?
So Chairman McDonald, at risk that we're going beyond the four corners of the actual bill in front of you that would repeal this program, we certainly can respond to the more broader questions that are being asked in terms of the demographics. You also have a plethora of individuals from these very hardworking entities that are out there to support that could also respond to these questions perhaps equally, if not better, than the department. And that it?
Okay, yeah. So I think if I'm understanding your question correctly, you are asking who makes the decisions about which populations come to New Hampshire. Am I understanding correctly? I just want to make sure.
No. Rather, what town they're coming to, and if they are bound to stay in that town for a certain period of time, and if you agree with the numbers that were said, that 7,000 were admitted and 5,000 refugees are currently staying in New Hampshire.
Okay, thank you very much. So, people, the clients that come here are not bound to remain in New Hampshire. Anecdotally, I'm aware of out-migration. How the numbers that we capture in our data are the number of arrivals. It would be impossible to, just track down the line. So I can't say accurately that those numbers are correct. Again, I'm aware of out-migration, as well as some in-migration. Okay.
Representative Tejas, you had your hand up. Then Representative Woods.
Thank you, Mr. Chairman. Thank you for taking my question. So you outlined how there's a funding stream called Refugee Support Services Funds that would disappear if this bill passes, a replacement designee NGO-led administered program gets stood up, because the state does not have to house the state refugee program. So the state refugee program will still exist in a different entity, but we're going to lose money. Can you also speak to the benefit of it being at DHHS? Because historically it wasn't there, and there is a reason for why it's been there for, 15 years.
Yes. So having that program housed within the state leverages all of the state resources. It makes it incredibly efficient because we can seamlessly interact with other programs within the state. And so it just makes it highly efficient. It provides oversight such that we know exactly the populations coming in and the numbers. Let's see. Okay.
Representative Woods.
Thank you, Mr. Chair, and thanks for taking my question. You referenced one of the goals of the program as it currently exists is to make them self-sufficient, I think was the term you used. Looking at national data that was provided us, it shows that indeed the return on the dollar is rather substantial for this program. Do you have similar data for the state of New Hampshire?
So we do not, however, I'm aware of the report that you're citing, that the return, compared to the amount of dollars invested at the outset is substantial. Anecdotally, that carries through to New Hampshire. And I think that the entities who are on the ground supporting the refugees can probably best speak to the success stories. The fact that people are buying homes and getting jobs and contributing to the economy.
Thank you.
I'm seeing no other questions. Okay. Oh, Representative Plaza.
Thank you. Thank you for taking my follow-up. So you mentioned that keeping it within department makes it efficient. So you know numbers. Do you mind following up and sending us some numbers about admissions?
And Chairman McDonald, we'd be happy to provide you with some additional information. Certainly as part of our contracts that we have in our auditing ability, we do track data, and we're more than happy to provide that to the committee. Just want to emphasize again, if this bill were to pass, refugees would still come here, we would lose state control, and we would lose the opportunity of around over $1 million under this Refugee Support Services Grant Fund. I think that's the totality of what we'd like to leave this committee with.
Okay, thank you. Representative Kesselring.
Thank you, Mr. Chair. I just want to ask if you could add to that any other grant programs, if you could supply that information that might be connected to this in some other way also.
I'd be more than happy to do that. We actually, and you probably are aware that as part of the budget process, all state agencies were required to inventorying certain types of contracts around certain subject matter. And so we actually went through and reviewed 1,000 contracts and identified 8, none of which actually are connected with this particular program. But we'll be more than happy to provide you with that information on the grants that were identified within our agency that did touch upon that subject matter.
One last question, Representative Tejas.
Thank you, Mr. Chairman. Thank you for taking my question. So I just heard you say that if this bill were to pass, refugees would still come and this money would be lost. Can you clarify, because are you saying you bring refugees here, or are we talking about other people would still bring refugees here and this program would also exist in state government? I mean, outside of state government.
That is an accurate statement.
Thank you both very much. Also signed up to speak is Bob Dunn from the Roman Catholic Bishop of Manchester.
Thank you, Mr. Chair, members of the committee. I'm Bob Dunn, the Director of Public Policy for the Roman Catholic Diocese of Manchester, and I'm here today on behalf of Bishop Peter Labashi to respectfully register our opposition to this bill. I just want to make 2 quick points. First, it's important to remember that these are documented immigrants. We have a national debate going on about what to do about undocumented immigrants. These are documented immigrants, and they've been thoroughly vetted by the federal government, presumably because this takes, in some cases, several years before they receive their status as refugees or asylees. And secondly, it's important to remember why these refugees came here. Representative Corcoran mentioned 8 U.S.C. 1101, and that's the governing statute, and that defines refugee as someone who is persecuted or who has a well-founded fear of persecution on account of race, religion, nationality, membership in a particular social group, or political opinion. That's why there aren't people coming from Ireland. That's why they're coming from Africa and other such places. They come from countries where they have this fear of persecution. And I think that it's fair to say that these are people, in large part, who have had to flee for their lives, or at least for their liberty. And they're therefore people who, in a unique way, have taken us at our word that we stand for life, liberty, and the pursuit of happiness. And finally, I just want to note that the U.S. Holocaust Museum in 2018 published some research that talked about how the U.S. immigration laws and policies in place in the late 1930s and 40s had played a large role in blocking European Jews from escaping to the U.S., including the family of Anne Frank, interestingly enough. And so I think we need to remember the lessons of history when we think about how we're going to address the issue of refugees in the 21st century. Thank you.
Thank you. Representative Weber.
Thank you, Mr. Chairman, and thank you very much for being here and taking my question. We were given by the prime sponsor a pretty bleak picture of what refugees both take from U.S. society and what to give to U.S. society. And I was wondering if you had a different view of the contributions of refugees once they are in your program and moving on, and tell us a little bit about what that looks like.
Yeah, I think that there are folks who are with the organizations that would have a better sense of that. I would think, though, that I would want to say that on a general level, the fact that we take refugees in as a state and as a nation is commensurate with who we are as Americans. It's the reason that many of our ancestors came over here. I'm the second generation born in this country. My grandfather was born as an unwilling subject of Queen Victoria in Ireland in the late 1800s. He might have qualified for this, but so I think that that has its own value, but I think that there are also economic issues, and I'm pretty sure that there will be people who will talk about things like healthcare, sectors where, as you know from serving on your county delegations, we've got a real healthcare staffing crisis. And so having refugees in the state, I imagine, is something which plays a helpful role in trying to address that in some ways. But there are others that can speak to that better than I.
Representative Palazzo.
Thank you, Mr. Chair, and thank you for being here. My question, the little that I know about this program is consistent that with your testimony that for some refugees it takes several years to get here, but given concerns that bill sponsors have, do you know what would be the fastest route? If the maximum is several years, what is the minimum to get here as a refugee?
I couldn't answer that with any certitude, Representative. Sorry.
Follow up.
Thank you. And my second question, do you have any numbers how many refugees in New Hampshire do your charities help?
I don't. I know Catholic Charities does not do the refugee resettlement. I think maybe in years past it did. It doesn't any longer. I would imagine that both Catholic Charities and parishes in the diocese provide assistance to refugees in the same way that they would provide assistance to anybody else that was in need, but maybe not particularly as refugees. So I have to plead ignorance on that as well. Sorry.
Representative Kesselman.
Thank you, Mr. Chair, and thank you for taking my question. So I get a question based on what you said. So prior to the 2025 changes to this program, the Catholic Diocese in Manchester was receiving federal money for resettlement in some way or another?
The diocese was not, I don't believe. I think Catholic Charities was working with refugees, but I don't know that they were receiving money under this either. I just don't know the answer to that question. Thank you.
Seeing no one else? Okay, thank you.
Thank you.
Also signed up to speak is Nicole Schultz from Building Community in New Hampshire, I believe it is.
Hi, good afternoon. My name is Nicole Schultz. I'm the Executive Director of Building Community in New Hampshire. I'm speaking today in opposition to Bill 1706. And I just wanted to take a moment to recognize that we're here on the fourth anniversary of the war in Ukraine. If this bill becomes law, it would close the New Hampshire refugee program and cancel more than $4 million of federal funding that currently supports refugee resettlement services in our state. It is important to be clear, the Refugee Program Office is fully funded by the federal government, not by New Hampshire taxpayers. This bill would not save the state money. Instead, it would require New Hampshire to turn down millions of federal dollars that are already allocated to support lawful refugees during their first 5 years in the United States. If HB 1706 passes, the state would stop managing these federal funds and cancel contracts with nonprofit agencies that provide essential services. One of those organizations is the organization I represent, Building Community in New Hampshire. And we know firsthand how critical both the coordination with the state office and the funding are to our ability to do this work effectively. These funds support services for refugees who have lawful status, individuals and families who have already gone through extensive federal vetting processes. The support we provide through this program includes workforce development, English language classes, job placement, school supports, and health access support. These services help refugees establish successful lives in the United States and reach economic independence and integration into their new communities. It is also important to clarify that what this funding does not do. The federal funding targeted by HB 1706 does not provide direct cash payments or housing subsidies to refugees. It helps organizations like ours cover staff salaries and operational costs so that we can provide structured, time-limited support that leads to self-sufficiency. If HB 1706 passes, New Hampshire will voluntarily turn down more than $4 million in federal funds. The need in our community will not disappear, but the infrastructure that supports successful integration will. The likely result will not be savings, but greater strain on local communities, employers, schools, and social services. For these reasons, I respectfully urge you to vote no on HB 1706, and thank you for your time and consideration.
Thank you. Questions? Any questions? Representative Drew.
Thank you, Mr. Chair. I don't know much about your organization, so can you describe the structure of your organization and as much as you're willing to tell us about how your finances work? In other words, you are receiving money from the federal government. Do you receive money from the state government? Do you receive money from private organizations? And then that all gets put together and does exactly what? Can you give a better description of that?
Sure. So we are a relatively small organization. We work with folks. We're not greeting people at airports or bus stations. We work with folks, after their 90 days resettlement up to 5 years. 2/3 of our annual revenue is from the Department of Health and Human Services. Our revenue in 2005 was just $650,000. The other 1/3 is from private foundations and individuals.
Follow up?
That's from the state DHHS or the federal HHS?
State.
State. Thank you.
Representative Palazzo.
Thank you, Mr. Chair. Thank you for taking my question. So, in that period from 90 days to 5 years of resettlement, do you have any observations on people leaving New Hampshire in this period, or otherwise somebody like after, 1-2 years in different state coming here and joining you and requiring help from your organization?
I don't have that data readily available. Anecdotally, I can say that people do come and go. Last year, our organization worked with about 400 people. I think 392 people.
Representative Weber.
Thank you. I just want to circle back. When you said your money comes from the state of New Hampshire, is that because it is money that's raised in the state of New Hampshire, or is it money that came from the federal?
The 2/3 is money that came down from federal into the state and then funded our organization.
So it was not actually raised in New Hampshire, it was federal dollars that were coming here. And obviously some of that was federal taxes. Okay, thank you. I just wanted to be clear on that.
Anyone else? Okay, thank you.
Thank you.
Also signed up to speak is Sarah, and I believe it's Ziyuch. I apologize if I didn't pronounce it correctly. Z-I-U-E-C-H?
Z-U-E-C-H.
Okay. Okay.
I'm Sarah Ziyuch from Salisbury. I'm here in support of HB 1706. I'm a mother of 4, and one lesson I try to instill in my children is that charity begins at home. And just like the individual's first responsibility is to care for his family, friends, and immediate community, so is it a government's responsibility to prioritize its own citizens. Legislators and others who are enthusiastic about changing the demographics of our state are obviously not putting the well-being of New Hampshire citizens first. New Hampshire's resources should benefit the citizens of New Hampshire. That's it.
Thank you.
Thank you.
Are you taking questions, or I don't know if there are any, but I'm seeing none. Okay, thank you.
Thank you.
Also signed up to speak is Lisa Bodwin from the New Hampshire Council of Churches.
Good afternoon. For the record, my name is Lisa Bodwin. I'm the Executive Director of the New Hampshire Council of Churches, which is an ecumenical association of 7 denominations. And as I said this morning, it represents 300 churches across the Granite State. Our member churches are guided by sacred texts that repeatedly and unambiguously command faithful witness through hospitality, mercy, and welcome. The Bible does not frame welcoming the stranger as a charity. It is, in fact, a moral obligation rooted in covenant, justice, and love of neighbor. You all should know that our congregations already embody this call through volunteer, hands-on ministry with refugees and newcomers. Churches help prepare homes, furnish apartments, provide transportation, assist with school enrollment, offer English conversation, accompany families to appointments, and build relationships that support long-term belonging. This is practical relational work that strengthens communities and fosters stability. Again, I will repeat, our churches do that with volunteer labor, and our churches would not be able to do that if organizations like Church World Service New Hampshire, which serves as the state's primary refugee resettlement agency, did not exist. They partner closely, as you heard earlier from Attorney Williams, with DHHS. Episcopal congregations across the state participate directly in refugee support through parish-based welcome teams and diocesan engagement. United Church of Christ conversations have long served as welcoming communities offering material support and accompaniment grounded in their faith commitments. And a Centuria Care Alliance, who you will be hearing from, that is a Lutheran-rooted organization, and the Lutheran congregations across New Hampshire are continuing to participate in refugee resettlement. HB 1706 would dismantle this infrastructure, sever partnerships that are already bearing fruit, and undermine both moral responsibility and public health stability, which you can read that paragraph in my testimony. HB 1706 reflects the bill itself, I would offer, reflects ideological, fear-based madness, and we must call on this body to realign with Jesus' clear teaching to love one another and welcome the stranger among us. The New Hampshire Council of Churches respectfully urges the committee to recommend inexpedient to legislate on HB 1706.
Thank you. Any questions? Representative Kesselring and then Representative Drew.
Thank you, Mr. Chair, and thank you for taking my question. So you did say something there that it was very interesting to me that the churches would, this program, if this bill passes, that the churches wouldn't be able to do that. Is because their funding is going to be gone, or is it going to be that the churches would no longer participate?
The infrastructure to support their participation would be gone. New Hampshire Church World Service and Essentia Care Alliance, they wouldn't be there. So it'd be very difficult for the churches to maintain their support.
Follow-up.
Could you clarify, is that because of the funding those organizations wouldn't be there, or could you tell me why those organizations would disappear?
Because without the money, they can't pay their staff.
Representative Drew and then Representative Weber. Go ahead. Sorry.
So could you clarify for me what services Church World Services and Essentia provide that are necessary to the work of your church groups?
Thank you for that question. I'm going to actually let church, if there's a representative from Church World Service New Hampshire, speak to that, and I know that Essentia Care Alliance is here.
Okay, thank you very much.
To share that.
I'll save that.
Thank you for your question.
Representative Drew.
Thank you, Mr. Chair. I'm a little rusty on my Bible, but does the Bible say anything about leveraging the resources of the government in order to provide the services that the church is tasked with by Jesus?
Thank you for that question, Representative Drew. What I know is that Jesus Christ repeatedly commanded us to love one another, to welcome the stranger, to take care of the poor and tend to the widow, and that was his highest, most important commandment.
I'm seeing no other questions. Okay, thank you. Also signed up to speak is Steve Scooch, I believe it is, from Hancock. Was I even close on that?
Wenn wir noch in Deutschland wären, man könnte das Schuck aussprechen. But yeah, that's close enough for here.
Okay.
Sure. So if I may, I wanted to read a short statement from David Blair, who would have been here yesterday, but could not come today. And then I have a short statement as well.
Okay, you only have 3 minutes, sir.
I'll do my best. Yep, so starting with David. I was the director of the ESL program for the Conval School District for 8 years. My students were mostly the children of Cambodian refugees. Through them, I got to know the community of about 50 Cambodian Americans in the Peterborough area. 3 generations then, and now 4. I've never met a harder working group of folks in my 50 years here in New Hampshire. They're devoted to their families, willing to sacrifice for their kids, serving the community on the road crew, in factory jobs, and serving their country in the armed services. 3 of the boys I tutored have served in the Navy, Army, and Marines. It is mean and short-sighted to try to exclude refugees from our state. They bring so much, above all, the desire to work hard and make a new life in a country they are grateful for giving them a lifeline. Sincerely, David Blair, Harrisville, New Hampshire. And I would say for my part, I have had the privilege of knowing and working as a volunteer with a number of refugee families and asylum families. I have invariably found them incredibly hardworking, incredibly kind. I wish that the representative could sit at table at a meal when a blessing is being given. I wish he could know the family that I know from Iran that was under death threats for their Christian faith in Iran. They have a very difficult time here in the States. They had university degrees. At home, they started with minimum wage jobs. They built their lives over. They are not living off the government or off of taxpayers. I could tell you of other families in similar situations. And I just wish that more people that have such harsh opinions. I heard him say he doesn't want state funding, he doesn't want federal funding, and his little document, he doesn't want volunteer groups or church groups or nonprofits, he doesn't want anybody. I'm looking at the language of what you had in this, or federal programs, or nonprofit programs, or grants, or otherwise help refugees or asylees. That's pretty bitter stuff.
We're not getting no debate.
But in any case, I would just plead and say, if you knew families, if you saw how hard these folks are working, it's a very different picture than you might have heard from the representative at the start today. Would you like a copy of David Blair's
That'd be great,
statement?
sure.
Did I bring that to you?
Sure, then. Come on up. Are you taking questions, or
I'd be happy to take a few questions so I don't pretend to be
are there any questions for this gentleman? Okay, I guess you're off the hook.
Okay.
Thank you.
Thank you.
Also signed up to speak is Maggie Fogarty, I believe it is, from AFSC, New Hampshire.
Thank you. Good afternoon, Mr. Chairman, members of the committee. My name is Maggie Fogarty. I'm the New Hampshire Director with the American Friends Service Committee, which convenes the New Hampshire Immigrant Rights Network. And you've received our testimony. I have printed copies to deliver as well. But I just wanted to clarify who we are. We are a statewide coalition of nonprofit organizations, faith leaders, immigrant community leaders, and regular people who are advocating for humane immigration policies so that we have an immigration system that is orderly and dignified and fair and welcoming, the furthest thing from what we have now. And we believe firmly that New Hampshire is a wealthier, stronger, more vibrant state because of the presence of those who have arrived over many generations, including those fleeing war and violence who participate in the refugee resettlement process, but also people coming for many other reasons. And most of us in this room, if we aren't indigenous or the ancestors of enslaved people, we would simply not be here if we accepted the framework that's being offered with this legislation, that there's not enough room or that people are so undesirable because of their racial or national identity or because they have experienced poverty and are struggling for economic security. So thankfully that these tropes, while they've existed for a long time, did not prevent our ancestors from coming. The American Friends Service Committee is a Quaker-founded organization, and since 1917, when we were first formed, we've been accompanying people displaced by war and violence, first in Europe. And in the mid-30s, when the pogroms began, AFSC organized pathways that saved the lives of many thousands of Jewish children by helping them to safely travel to other places. This was at a time Kristallnacht in 1938 when Hitler Youth and paramilitaries were murdering people in the streets, burning synagogues, etc. So our commitment to this work is long and deep, and it explains, why we continue to show up to advocate for well-funded refugee resettlement and humane immigration policies. We do this work in our commitment to love and justice and compassion. So please push past these toxic tropes. We have ominous lessons from history of where they take us, and we know better. So thank you very much.
Thank you. Any questions? Representative Weber.
Thank you very much, Mr. Chair, and thank you for being here and taking my question. So my question is, we know that we have many, many jobs on our state level that simply cannot be filled because there are not people to take those jobs. Could you speak a bit to the contribution of refugees to dealing with that issue for our state?
Yes, thank you. Others can speak better to the data aspects of that, but I can speak with certainty to the fact that people arriving through the refugee resettlement programs are a vital part of our economy as workers, as owners of small businesses, as consumers, and then beyond that too, as members of our churches, pastors in our community, parents of our school children. So they offer the same kind of strength and vitality to our economy and our social life as the rest of us do.
Thank you.
Thank you.
Representative Kesselring.
Thank you, Mr. Chair, and thank you for taking my question. So I have a question for you because I've been doing this, the organization's been doing this a long time.
Yeah.
So prior to the 70s and 80s, when all of the refugee resettlement came in, was the organization still performing these tasks and these duties prior to that?
Yes, thank you. As I said, from our very beginnings now, 109 years ago, we have been working with others around the world to provide essential supports for people who, through no fault of their own, have found their basic safety and security stripped from them.
Follow-up.
So I'm going to ask a pointed question. If the funding for this program went away, do you think your organization and others would step in?
So our organization doesn't provide the direct hands-on relief in the particular voice that we're speaking to here. It's for the kinds of policies and investments that make this work possible. So we'll continue to do that. And the many ways that have been named so far, both through nonprofits and through individual people, that it would all be harder. We keep putting more and more burdens on the charitable sector when we divest from our responsibilities in the public sector.
Let's see, Representative Drew.
Thank you, Mr. Chair. I'm going to ask you the same question that I asked the other gentlelady from the NGO. Could you give us a brief description of how your organization is funded, where your money comes from, and where that money goes to? Thank you.
Yes. The American Friends Service Committee doesn't accept any government grants, so we are funded by philanthropic grants as well as individual donations. And I'll say I did not recognize the characterization that the member organizations of the New Hampshire Immigrant Rights Network are benefiting financially from the work of refugee resettlement.
Okay, I think we're all set. Thank you.
Thank you.
Also signed up to speak is Jeremy Kaufman from Manchester.
Thank you, members of this committee. I am Jeremy Kaufman. I live in Manchester with my wife Rachel and our 4 children, and we actually live near the area where many of these refugees have been resettled over the last 20 years. But I'm actually not here to come with personal story. I'm not even here to come with too much evidence or facts. I'm here to offer you permission to change your mind. We recently had a battle in this country over whether sex differences are real. And the truth almost lost in that battle. Well, 70 or 80 or so years ago, we lost a battle. And we all grew up in a world where we were told that every single person in the entire world can somehow become an American and can somehow be an asset to the great state of New Hampshire. Maybe that lie was necessary at one point. Maybe it was even noble. But it is not true. And now that lie is hurting us. I don't want you to necessarily believe me or believe what anyone else has said on either side. I want you to go home and look this stuff up for yourself. Look up the facts that Travis offered you and look up whether the things that the people on the other side said are true. But I want to give you permission to escape the lie. This isn't about hate. This is about love. Love for the values that I want to persist and continue to exist in the world. This is about our posterity and the next generation being able to live under those values. I believe more than ever, Western civilization itself is under threat. And I pray that you do not contribute to the death of it. If other organizations here want to continue that work, they are welcome to. But you, everyone on this committee, has the choice of whether they vote to be a part of it. Thank you.
Thank you. Also signed up to speak is Henry Harris from, I believe it's IINE.
Yes, thank you, sir. It's the International Institute of New England here in Manchester. My name is Henry Harris. I'm the managing director for the Manchester site. We resettle refugees. They're here legally. They are well vetted. Takes years to get in this country the way we, through the Office of Refugee Resettlement at the Fed level, they're vetted at least 3 times out of country before they get here. It's a very slow process, and for some people it can take up to 20 years. We've had clients that have sat in a camp waiting 20 years to get in the country. That aside, I just want to pull politics out of this for a second. I saw a lot of head shaking going on both sides, agreeing, disagreeing, and it's fine. The bottom line is you don't have to, no matter what side of the aisle you sit on. Well, actually, let's do a little experiment. Raise the hands. How many people are 46 years and older in this room? Including all, I see, yeah. I'm wearing it. That is the average age of our workforce. 30% of our workforce is on the other end of that, rapidly approaching retirement age. New Hampshire is facing a workforce shortage. We are ranked between 1 and 2 of the oldest workforces in this nation. The trades show for every 1 person entering construction, 2 are retiring. That is not a ratio for sustainability for the future of this state. There's also a massive healthcare shortage simultaneously occurring at the same time, and that is not a great diagnosis for economic health when the majority of the population is aging out and will require the most medical attention the state has ever experienced within this decade. Shortages. INE has a very successful LNA nursing program. We are in our 11th cohort, 100% graduation completion, and 98% of the students pass the state exam on their first or second try. This checks a lot of boxes for this crisis. We are moving that towards. That is refugees doing that. INE also contracts with employers to teach English classes and skills training on site. These are employers willing to give up some of their profits for us to teach folks. Not only the English, but the skills they're going to need to move into better paying jobs because they can't fill those positions. If that's not proof that there's a need and a shortage in workers and that there's actually a need for refugees to fill these gaps, that's a pretty significant claim. The other downside to
about 10 seconds left, sir.
All right, we are coming out of a lot of companies are going to leave, and that's going to have a negative effect on our tax base, our quality of life, our schools, and all of that. We have over 150 employer partners around the state. These are big companies. They're every hospital in this state, our public schools, and Regen Valley, a biotech company that's coming. I'm on the consortium for that.
Okay, sir, at this point I'd like to, are you taking questions or?
Sure, be happy to. I can even address some of the ones that went by the wayside.
Okay, sure, thank you. Representative Weber?
Thank you very much. Thank you very much, and thank you for taking my question. I'm very concerned about the workforce issues, both in the healthcare field and in other fields. So it would be very helpful to me to know what areas you have seen refugees fill jobs that, as opposed to taking away jobs from citizens already here, are filling jobs that are desperately needed.
Well, I mentioned healthcare. home health care, they're in advanced manufacturing, they are in IT, they are in, I mean, you know, just because someone's a refugee does not mean they don't come to this country with skills. You heard a lot about people not being educated. That does happen on some levels, but you know what? People come with skills. They know how to work. Work is not unique to being an American, right? So they fill jobs here in this state, in this country, that either people aren't doing, or that for their first time out, they're building skills, language-based, and then they move on to other skills. So we have two employment programs. One is survival employment, where we get people jobs right out of the gate, because our goal is to make people self-sufficient. We don't want people going down to welfare. That's not what this program is about. Then it's about circling back after they've been here a little while. They've got more English skills. We have English programs we teach. We have case management to help people not fall through the cracks. And we have employment programs. Then we circle back and we look at career pathways. What do you want to do that's meaningful to you that you can give back? And so that's either going back to school or LNA program like I spoke of. We have people who are working on PhDs. They are contributing members of our community, and they're paying taxes from the get-go. You're hearing all this stuff, but it's like, I'm going to let my counterpart Bill talk to he's got bullet points for a lot of the things that were said about all the negative things. But like, in terms of our programs here, this checks a lot of boxes for our aging state. That's a reality. That's a reality. I mean, we are all aging. You saw the hands in this room. That's a good snapshot of what's here. And with that age group that's moving out, most of the people with the knowledge base and the experience are in that group. We are fast on the track for losing a lot of our employment workforce. Any other questions?
Other questions? Representative Drew.
Thank you, Mr. Chair. So at this point, you know it's coming. Can you give us a brief description of where the funding for your organization comes from and where that money flows to?
Sure. So there's couples. You know, I gotta be honest. Our government has a lot of programs. It's Fed funds that come through the state. We have, when we look at the refugee resettlement program, it's the first 90 days someone is here. These are not. There was a reference that someone ended up on a spreadsheet and we're asking for. That's not how it works. The Office of Refugee Resettlement at the Fed level processes all the applications. They go through, and then they go through based on what we worked out with our government, state government, how many people can we bring to this area. So we don't try to shoot for the moon. This is a specific target for a year based on the presidential determination that's set between the president and Congress. And then we work out a number. So like for this year, it's like 70. We never hit those numbers every year. It's always a little lower, but we're not asking for people to come here. We are getting caseloads that are assigned to us. We welcome them when they get here. And then we do heavily private funds to fill in the gaps because not all of this stuff gets covered. And the state provides oversight on how we run those contracts to make sure that we are upholding what the feds want.
Follow up.
Yeah. Thank you, Mr. Chair. You said caseloads that are assigned to us. Assigned to you by who?
Office of Refugee Resettlement from the Fed level.
Awesome. Representative Woods.
Thank you, Mr. Chair. This is would you believe that Einstein was a refugee and Werner von Braun, the father of our space program, was also a refugee?
I would. So thank you.
Representative Kesselring.
Thank you, Mr. Chair, and thank you for taking my question. You might not be the right person for this question, but I figured since you work with refugees and all that, if a refugee, let's say, comes to this country and commits a heinous crime, would they be removed from any programs? What's the process?
I'm glad. Thank you for bringing that up. One of the biggest myths right now is there's been a lot of lumping of people into one category. That's all under refugees. There are criminals all over the world. Doesn't matter where you come from. They're here. But to be a refugee in this country, if you screw up, you lose your pathway to citizenship. So anything above a misdemeanor is really cutting it. You're going to be you're not on a path for citizenship anymore. So our clients that we work with are very motivated to do the right thing and not break the law.
Follow up?
So just to follow up with that, have you seen that happen where they have been removed or anything along those lines when they've committed something? Have you gone through that?
In my 5 years working here, I've never had anyone get anything more than traffic violations.
Anyone else? Representative Tejas.
Thank you, Mr. Chairman, and thank you for taking my question. So just to clarify, your organization receives federal funding to resettle people directly with your relationship with them and get some of the funding from the state refugee program, which is pass-through money from the feds through the state, so you can do additional programs.
It's Fed money coming in, yes. So if there's to help kids with school and integrate and things like that, yes. And health care, we want to make sure that people are doing all the checks to keep the community safe. There was a mention about disease control and things like that. They all receive medical attention right out of the gate in the first 7 days.
As a follow-up,
they test and we know what next steps need to be followed up with.
what would be the impact of this bill passing so the state refugee program ceasing to exist at the state government?
I think regardless, people are free to move around the country, right? You're going to get people moving and they're going to come. And agencies like ours can also take walk-in, we might not be able to provide any money for any services that is not directly related to a contract, but we can refer to other agencies. We can sort of support people by connecting them to a network of support. You're going to see a lot of people showing up at welfare is what you're going to see. And we try to avoid that at all costs because that's just, first of all, you don't want to drain our system on that. You want to support people to be successful, and it's really not that hard. Where all this really is looking at it through an investment. Yeah, it takes a couple of years to get on your feet. Can you imagine going to some other country and trying to navigate it? Good luck. Good luck. And I know people disagree with that. But however, it's like you're here. You can either be successful through some minimal supports, which in years over tax base, you're paying taxes. You are being productive. That's an investment that will come back tenfold on you. And Bill will talk to some of those things coming up.
One more follow-up.
Thank you. Do the refugees themselves pay for the costs of resettlement or flying in?
Yes, they do pay back over time. I mean, they've got a runway to do it, and it's over within that 5-year period because that's what their services people. So the first 90 days. That's resettlement. That's crazy. You feet on the street, you got an apartment, you're settled, start working on jobs, start getting kids enrolled in school, you do all your health stuff right out of the gate. The next 5 years, people will come in and out of those services. We hope that on day one, after 90 days, they're self-sufficient and off they go, but they might not be. And they might be 3 years in, and suddenly there's a huge layoff. And then you've got people trying to navigate what do they do next. They come back to us and we find them jobs, we help them navigate anything that they would need support with. But the goal is to move people off that as quickly as possible. I mean, this is not a handout. It's an investment. You got to look at it that way. It's not like just taking, money and burning it. It is actually going to pay back in time.
Okay, I'm seeing no other questions. Thank you. Okay, at this time, we're going to take a break from this hearing. We are going to come back to it, but we do have another hearing we're overdue to entertain. So I'm going to, again, take a break on 1706, and we will be coming back to it a little bit later this afternoon. In the meantime, I would like to open the public hearing on HB 1772 FNA and ask Representative Michael Moffett to come forward. He is the prime sponsor. Thank you, sir.
Thank you, Mr. Chair. I hope everyone is enjoying their spring break. And for the record, My name is Representative Mike Moffitt, Merrimack District 4, the always beautiful towns of Canterbury and Loudoun. And I also chair the State House Committee on State Federal Relations and Veterans Affairs. So, ibogaine. Ibogaine comes from a Central African shrub, and it's a psychoactive compound that has long been used in spiritual practices and now shows promising results in mental health treatments. So ibogaine has a Schedule 1 status. I know this committee is familiar with that type of thing. It's for thousands of American veterans, which is how I get pulled into this. Thousands of American veterans have gone abroad, mostly to Mexico, where ibogaine is unregulated and available through private clinics. So the profoundly impactful results of ibogaine therapy are seen in a Stanford medicine study showing an 88% decrease in PTSD symptoms, 87% decrease in depression symptoms, 81% decrease in anxiety symptoms a month after ibogaine treatment in a cohort of 30 special operations veterans with a history of traumatic brain injury, that's TBI. And additional trial results published in Nature Medicine showed significant improvements in concentration, information processing, memory, impulse control, and more following ibogaine treatment. So bottom line, promising breakthrough treatments involving ibogaine can help military veterans with PTSD, TBI, and other mental health conditions by eliminating the need to take medication every day and targeting the root conditions driving suicidal ideation, hyperaggression, depression, or many other conditions many veterans face. Ibogaine may indeed be a miracle drug that has given powerful indications of being able to regrow brain cells, something once thought to be near impossible. So, are there side effects? Inevitably. So medical professionals, as opposed to me, can better describe the balance between therapeutic breakthroughs or clinical trials, balancing that with possible problematic side effects. So I learned about ibogaine at a legislative conference in Indianapolis, where I'm a member of a national legislative veterans task force. And I'm also a member of a second national veterans task force that met later, a different organization, in Texas. So at that Texas conference, former Texas Governor Rick Perry, many of you have heard of him, he could not have been more emphatic, former Governor Perry, in his advocacy for ibogaine. He said he'd been a businessman, he'd been a legislator, he'd been a lieutenant governor, he'd been a governor, he'd been a presidential candidate, and more. And with his long life of involvement with countless initiatives, programs, legislation, endeavors, everything he's been involved with, he emphatically spoke to a large group and said, by far, the most important, substantive, promising, consequential issue he's ever been involved with, by far, is ibogaine. So Texas obviously is at the forefront of this in terms of creating processes for ibogaine treatment. Governor Perry, by the way, gave a shout out to other states, including us, New Hampshire, who are trying to become early leaders in looking at how best to make this miracle drug available to those who desperately need new treatment options and hope. And while for my purposes there was initially a veteran-centric focus, there are treatment opportunities for all kinds of folks who have suffered TBI, again, traumatic brain injury, whether due to a IED explosion in Afghanistan or a rollover traffic accident on I-93. And besides TBI and PTSD, there's also the substance abuse issue, which obviously involves all kinds of different populations. There's, beyond what I've already mentioned, the existing evidence of how ibogaine can help with substance abuse treatments is profound. You'll recall that last year we passed a right to try law to address liability questions and allow terminally ill patients opportunities to access treatment options that might give them hope. Governor Ayotte held a signing ceremony, which some of us attended. So, you folks in this committee know the issues, the laws, the agencies, the experts, and much more than me to better evaluate the efficacy of this proposal to allow New Hampshire to participate in a multi-state consortium to conduct sanctioned clinical trials regarding ibogaine. So, and I've shared a great deal of detailed information electronically with the committee already, so you should have that. And I won't get into the weeds and the details of all the different pieces of this. And obviously there are many, many, many different questions and pieces to this moving forward. So the first step is this, to have this hearing, to get it on your radar screens. And there are others who can better address certain aspects of this better than me. I know, and you know, that there have already been some suggested amendments. Representative Edwards is a co-sponsor, and he's a former member of this committee, and he knows the people and the processes in terms of perhaps streamlining or making this easier to move forward. So I know he's talking about friendly amendments. My purpose here is to introduce this measure, this bill, as it went to OLS in September for your consideration. And so the sponsors, thank you for your time and consideration, and I'd be happy to try to answer any questions if there are any.
Hey, I had a quick question before I recognize Representative Weber. That is not a misprint. $1 appropriation?
That's right, which is very significant in the second year of a term. To get this started, to establish a fund that down the road can receive support from wherever it may come from. So we need to establish a fund. I'll donate the $1 if it comes to that.
Thank you. It's very generous. Representative Weber.
Thank you, and thank you very much for being here and taking my question. So my understanding of consortiums or compacts or things like that are people who generally have an established program and they're just seeking permission to implement it here. But am I correct? So why is it that this can't be done that way as opposed to requiring the Department of Health and Human Services to set up what is going to have to be a whole new program and infrastructure in order to administer this?
Sure, thank you for that good question. Of course, a compact is an interstate agreement, which oftentimes doesn't necessarily have to involve the federal government. So knowing that, for example, Texas and Arkansas are already way ahead of us, if we were to become enter into a formalized compact with states like that already have done a lot of the homework and due diligence and all that, that can help things to move quicker for New Hampshire. In terms of the structure involving this committee or HHS, that is something that I kind of would defer to you all, because you're, as we said in the Marines, the duty experts, like Representative Edwards, who is a co-sponsor. He understands better than me the dynamics and the inner workings and hidden mechanisms that go along with moving something like this forward in New Hampshire with HHS. So not a great answer, but I guess part of what I'm saying is you're all much better informed than me as to this type of thing, and you'll think of the questions and processes to make this work in some fashion.
Follow up. Just reminding people that we have 1 week before we have to vote on these things. So my follow-up question, recognizing that we have 1 week, is that I'm afraid I've lost all control of my paperwork. Among the things that you sent us, did you send us a proposed amendment for this?
Yes, there was. Representative Edwards actually, he called it a friendly amendment that has been sent, I believe, to, if not the committee, certainly, thank you, Representative. It sounds like it has gone to the committee for your consideration, right? So that's
I will dig for that. And one just final. So has that been drafted by OLS, or is that just the language that he sent? Is it an actual OLS amendment? It is. Okay, never mind. Thank you. You're off the hook.
Thank you, Representative Woods.
Oh, okay.
Thank you.
Okay, other questions? Representative Lamonte.
Thank you, Mr. Chair. Thank you for taking my question. I'd never heard of this before. So is it a hallucinogen like psilocybin is?
It's not like psilocybin. It's I had a little definition here. It's as I said at the very top. It's from a Central African shrub. It's only found in Africa. Or I'm sure they're probably transplanting some of those plants around the world now. It's a psychoactive compound. So a psychoactive compound obviously has affects the psyche. Not totally unlike a psilocybin thing. I know you've had a couple measures on that, although this is different. So, and to be clear, as I did mention in my testimony, there are significant side effects potentially that are important, of course, very important to be aware of. And there's all kinds of information out there about the side effects. So it is a psychoactive compound, and there may be some folks in this committee that have more medical background that can better explain what it means to be a psychoactive compound.
Other questions? Representative Woods.
Thank you, Mr. Chair. Thanks for taking my question. As it stands right now, putting the amendment aside, it makes reference to the consortium. I have not seen anything about the consortiums and its maturity. There are, and this committee's had to deal with this before, the bylaws have certain aspects such that certain things that happen once a certain number of people join the consortium, and some of the background material has not been worked out. And so we, at least from my perspective, would need to know something about that consortium, because it does trickle down to issues like the IRB and investigational drugs and how all that is handled. Are there any insights on that consortium?
Thank you for that, Representative Woods. I don't have a lot of insights or response to that. I know we're hearing this bill fairly late in the process. So it's February 24th or whatever it is today. So I know, as Representative Weber pointed out, there's a time constraint. But I would be happy to, in the days ahead, because I know there's not much time, to track down whatever I can. And there may be, hopefully, some other folks who are able to be here. There were some folks who were going to travel yesterday to be here. Of course, we were snowed out and aren't here today. But again, in all candor, knowing that you folks, this is your world, much more than it is my world. Not that I'm just throwing this at you, but you all, I kind of assume, presumably just can ask the questions like you just asked about the consortium and the process and the things necessary to move this forward. Representative Edwards is out of state, but he's co-sponsor, very interested in this, and he's the one who put together the friendly amendment that you have.
Right. Representative Lucas, and then Representative Hartnett.
Thank you, Mr. Chair, and thanks for taking my question. Does the consortium have a reliable source of ibogaine?
Good question, and I don't have an answer right now. I would say, because this is in the infancy, this initiative is in the very infancy in terms of accessing actual ibogaine. It is a Schedule I drug, and in terms of if we move forward with this and have clinical trials as part of a consortium or a compact, getting access to this substance, great question, and I don't have a good answer, but I'm sure that the states that are already doing this and have actually legalized it, Texas and Arizona, for starters, could tell you how they handle it, and that's something that probably isn't too hard to find out, but I don't have a specific answer right this second.
Thank you.
Representative Hartnett.
Thank you, Mr. Chair. Thank you for taking my question. We're throwing around a lot of sort of inside baseball terms of IRB. There are other ethical considerations when you're involved in research. And do you know if the department has any experience in managing drug trials?
Thank you for the question. I know Representative Edwards specifically pulled in a couple of doctors and specialists from the Department of HHS as opposed to the committee in HHS. And I know I'm kind of deferring to his friendly amendment and his contacts, but there are lines of communication that have already started to be established through him with HHS to hopefully answer questions and get this started in New Hampshire if there's sentiment to do so.
Follow up. Do you know if they have any experience to that end, though?
Question is, do I know if they have any experience to that end? I do not know that. I have to assume that if they're long-term medical professionals and doctors with some background in this type of treatment, that they would have some serious experience there. And if Representative Edwards is watching from wherever he's at, hopefully he's taking notes so he can give better answers than I'm giving at this moment.
Representative Weber.
Thank you, Mr. Chairman. Having now looked over the a proposed amendment, it simply says that the prescriptions given shall be for investigative purposes only. But that doesn't, how does that answer all the questions that we have raised?
Thank you for that. The purpose of the amendment that's already been generated is to streamline and simplify the process. A lot of the jargon, the verbiage that you see here is stuff that is language that we adopted from other states who've had success moving this forward. And it's so often the case, and I chair a committee, I know quite oftentimes we'll get draft language that works somewhere else and we'd adapt it or customize it to New Hampshire. So the amendment that Representative Edwards and company are very excited about, the intent is to simplify and streamline. He used the expression KISS, which some of you know what that acronym stands for. That's his approach to trying to get something simple that can get a placeholder section of statute that can be in place with a fund with $1 in it, whatever, so that in the future we'll have a head start on so many other states that haven't done anything yet. We're one of the around 10 or 11 states that are, early on trying to look into this and see what we can develop. So,
Representative Kesselring.
Thank you.
Thank you, Mr. Chair, and thank you for taking my question. So, being that I've worked so heavily on the experimental treatment center bill that we're going to hear next session, I do see that there's some overlap issues that we're going to have. So, I don't know. I'm just telling you right now. I see that based on my experience, we're going to have in line on section 2, page 2. The investigational treatment application information, some of the things that we have under the new Right to Try framework, we're having some issue with. That's why we have the new bill too for Right to Try to kind of clarify. So off the bat, I see 5 or 6 different issues with the way this is worded. Doesn't mean that we can't fix it. Just means that it's going to take some time. If I were to send an email to somebody, would you guys be willing to look at all of those things and figure out how you could fix them without? Because I don't know if the committee would have time to go through all this.
Sure, I know there's a lot there. And of course, if you wanted to send me some specific questions or issues or bullets for us or for me and my fellow sponsors and supporters to track down in the short term, of course, we jump right on that and try to get you what we could. And again, your points that you just made go back to what I said earlier about you folks being able to look at the language much better than me, which I can see you're doing. So, and that's part of the purpose of having committees and specialists, so to speak.
Representative Woods.
Thank you. This is just, if this discussion is, I think, clearly going forward, just for clarity, on page 1, line 16, you have Roman 2, yet when you go over to page 2, line 10, you also have Roman 2. On line 10 of page 2, I think it should be a Roman 3. So just if it's going to go forward, it might lead to some confusion.
Thank you for that. Good attention to detail, and that's I don't know if it's an OLS thing or a proofreading thing, but again, that's why you have a crack committee here that picks up on that stuff.
Other questions? Okay, I'm seeing none.
Thank you, Mr. Chair.
Thank you for acknowledging our brilliance there.
Also signed up to speak is John Williams from the Department of Health and Human Services.
Chairman McDonald and members of the committee, good afternoon. John Williams, Director of Legislative Affairs. I just wanted to clarify that I did have an opportunity to work with our Chief Medical Officer, Jonathan Ballard, when the request was made of the department by Representative Edwards to see what could be done with the bill. I'm not here to address the bill that's in front of you, which I know goes counter to the instructions for procedure, but I just wanted to clarify at least the context to this amendment that's being discussed, that it was worked on with Jonathan Ballard. I'd assisted him with getting it drafted so it could go to OLS at the end of December. And some of the thought here was in terms of placement. It fell within the Board of Medicine, the physician surgeons section, and it falls right after the administration of epinephrine. So we thought, at least in terms of placement, it made sense. I do know that Dr. Ballard engaged Dartmouth, Hitchcock, and those staff who are actually involved with clinical studies that look at things like institutional review boards. And the thought would be that the language would at least open up enough to be able to allow for those existing processes under federal and or state regulations, laws, for giving those physicians the opportunity to administering this particular scheduled drug if it is part of an investigatory, well, whatever the language you see in the amendment that I'm just pulling up because I don't have the actual copy. I just have the draft language that we had provided, but it sounds like it's absolutely 100% consistent with what language you have in front of you. So I just offer that. We're not taking a position on the bill, but I think we did at least try to address the fiscal concerns that were had, because certainly $1 appropriation is not going to be sufficient, and it also gets the department out of the business of doing what I believe Representative Harkness was questioning about in terms of doing clinical studies on drugs.
Okay, Representative Weber.
Okay, so I'm really embarrassed that I did not read through all of the information that Representative Moffett sent me this weekend because I am so far behind right now I will never die. But could you explain to me clearly and succinctly what the amendment that I have not seen, and that is my fault and I apologize, actually does? And is it, because what I saw was a one-line amendment and I didn't have a chance to read over Representative Wood's shoulder, but does it replace the entire bill or does it just change something in the bill? Do we have to do all of this, or are we looking at just allowing a physician to use the drug for investigational purposes, which gets around all of the stuff in here that's an issue and all of the stuff that's creating a new department within the department?
In carefully crafting the language that was provided to the Representative Edwards, it states that it would amend the bill by replacing all after the enacting clause with the following. We had identified many issues just for being able to do this, not mentioning the appropriation to support it, but there was other issues as well with the underlying bill. This was the accommodation to remove that fiscal implication and provide those providers who are engaged in those investigatory studies on a replace all amendment to be able to do this. So at least opens it up for those who would be interested in providing those types of studies.
So as a follow-up, if we look through our correspondence and find that amendment and thought that that was a good solution to get us on the path, then we wouldn't have to deal with all the institutional review issues and compact issues that go with this. We would simply give the licensed professionals the ability to do the investigation that they think is necessary to determine the best uses or not of this substance.
Yes.
Thank you. I am so relieved.
Representative Woods.
Thank you. I'm sticking on this very point. I'm not sure I completely understand yet. The amendment seems to just to allow the prescription for an investigational drug named ibogaine. If there is such a study, if there is no such a study, it just stands by itself. So until the original bill is actually promulgated, having the amendment in place instead will accomplish nothing because there is no vehicle for it to occur. Is that correct?
I'm going to parse that out just briefly. My understanding was the accommodation in the replace all amendment was to give an opportunity for a physician who has a clinical study on this particular scheduled drug to be able to not violate their license under the Board of Medicine because it's embedded within the physician surgeon statute. And again, as I mentioned, we were careful in making sure it came right after the epinephrine, which also provides some level of immunity for physicians. So I do think it serves some purpose, absent Dr. Ballard being here next to me to explain more from a clinical perspective. And it certainly gets us out of harm's way when I talk about some of the complexities that are involved with the underlying bill, not to mention the $1 appropriation. This gets us completely away from that. I'm not disagreeing with you that, absent Dartmouth Hitchcock, for example, or some other institution that wants to do this, it may just be one of those statutes on the book that actually is never actually utilized. But if it were, but it is available to be utilized if there was an interest by a physician and a clinical study to do that. That's my understanding of the amendment.
I want to make sure there is a definite connection between just saying that he can prescribe it and he's actually part of a program. There's two separate processes. One, me as a physician writing the prescription, knowing that it's an investigational drug. Okay, I'm going to give you this drug, and it says I can do that, but it doesn't say I have to be a member of that investigation.
I'm just reading the plain language, Representative Woods, from here. And it says the prescribing of ibogaine by physicians and other prescribers. So I think our goal was to have it also be for obviously other clinicians who'd fall under that physician or under having prescribing authority for investigational use only shall be permitted.
We can.
And Dr.
Right.
Ballard will be back in the state first thing next week.
Representative Palazov.
Thank you, Mr. Chair. I don't know if you're the right person to ask, but so we have potentially a miracle drug, but also with some side effects. So how much information does department have on this medication if it happens in Mexico, even if it happens to hundreds of US citizens who go there, like they come back, maybe they have, I don't know if they have some side effects when they come back, but they have some effects and experiences, like how much department know about this medication.
Well, like many of the physicians that serve on your committee, physicians are required obviously to keep up to date and read clinical journals and things like that. So I would imagine, somewhat speaking on behalf of our chief medical officer, that he does keep himself up to date on things like this. And in fact, in working within the drafting language, and we're neighbors just across the hall in our office when we don't have the problem with the building being shut down, that I get the sense that he is familiar with this. But this is something that we are not in the business of doing investigations and clinical trials. That's not what we do. If you want us to do it, you're going to have to fund it, and you're going to have to fix many of the provisions within the underlying bill based upon my conversations with Dr. Ballard.
Okay. Anyone else? Okay. Thank you. Also signed up to speak is Dr. Mindy Asbury from the New Hampshire Community Behavior Health Association. Make sure you put your microphone.
Thank you. Thank you. Good afternoon, Chairman McDonald and esteemed committee members. Thank you for providing me with the opportunity to testify today in opposition to this bill. I am here representing the chief medical officers, of which I am one, medical directors, and chief executive officers of the 10 community behavioral health centers across New Hampshire. Collectively, we provide care to 55,000 Granite Staters who suffer from mental illness and or substance use disorders of all ages. I first want to say that I'm not here to speak to the utility or the effectiveness of this agent, although I'm happy to provide some background and information about this if asked. I do want to give some of my personal background so you know why I specifically am testifying on behalf of this group. I'm a medical doctor. I did my training at Duke University School of Medicine, and I also have a PhD in neuroscience where I studied pharmacology. In my prior position, I functioned as a co-director of a research institute in North Carolina, where we did conduct clinical trials. So I do have experience and knowledge in this area. Our first concern is that we do not see a place for legislation as it is involving clinical trials. There are currently well-established and commonplace methods and mechanisms for organizations and institutions to follow if they choose to participate in a clinical trial. These have been established in order to provide guardrails for safety, quality, and integrity. And in my experience as conducting clinical trials, even the smallest deviations from standard protocol can yield safety concerns, can question and jeopardize trial integrity, slow things down, and also lead to increased administration burden and costs. The next point I would like to make is that the unintentional messaging that this may send if this experimental substance is included in legislation. This experimental substance is used to target individuals who suffer from psychiatric or neurological or substance use disorders, and that represents a lot of our vulnerable population. Those individuals, by virtue of their condition, at times have a challenge in decoding messaging and understanding complex information. So to integrate legislation with an experimental substance, it could send a message that our state and our legislation says that this is a safe and effective medication. And that may lead our vulnerable individuals into participating in a clinical trial that they would otherwise not participate in. As an example, I was telling a medical colleague that I was coming here to testify today, and her response was, "Oh, so the state has approved that medication? That's unusual." So that's someone with medical education who has been confused by that message.
You could start wrapping up, please.
Yes, sir, will do. Lastly, our fear is that if there is an adverse event or outcome from this trial and the legislation has inserted itself in it, then some of the blame may be placed on legislation, which could rupture reputation for our esteemed legislation. And we do not want that to happen because we want to continue to partner with you and have the members of our society look at you with the utmost respect. So in sum, there is grave risk to this trial and legislation involving themselves, but the benefit, we do not see any to our population or to our patients because there are other methods and mechanisms that exist for organizations to wish to participate in clinical trials. Thank you, sir.
Representative Lucas and then Representative Weber.
Thank you, Mr. Chair. Thanks for taking my question, if you feel comfortable answering it. And it has to do specifically with Ibogaine. We heard earlier that it's derived from a plant source in Africa, and that studies have shown that that particular version of the drug can cause cardiac arrhythmias. And my other part of my question is that there's an effort underway, I think it's UC Davis, in synthesizing ibogaine. And are you aware if that has succeeded and whether or not there are any clinical trials underway with the synthetic version of this drug?
Thank you so much for the question. Very thoughtful, and sounds like you certainly have done your research behind this. From my most recent understanding, there are not currently any trials that have concluded using this synthetic version of this drug. I want to expand on that for a minute, if I may, and I think you're highlighting a very important point, and it is that things that are natural or have a medicinal name to them, such as this is natural, it comes from bark, that doesn't mean that it's healthier. And in fact, these types of agents have very poor selectivity and specificity in the brain, meaning that it doesn't distinguish where it needs to act, nor does it distinguish what it does when it acts there. Whereas medications that are created in a controlled environment, they have a high degree of specificity and selectivity. So they're manufactured specifically to target one area in the brain, because then we know what it is doing and that it's not harming other areas of the body. But this experimental substance is not made in that way.
Sure. Representative Weber.
So I just want to be really clear. Is it my understanding from your testimony that there is nothing currently that bars anyone who wants to do a properly reviewed investigational study of ibogaine from doing it in the state right now?
Yes, ma'am. If a organization or institution follows all the appropriate protocols that are already in place, then that does not preclude that. In my read of this legislation, there are some provisions that I find out of the ordinary from policies and protocols that currently exist. And I do not understand why some of those are in there. And the fact that we do have institutional review boards are in place to protect our individuals who participate in clinical trials. To have anything that circumvents that, in my opinion, poses a substantial risk with no clear benefit to our patients or our public.
Follow up, sure.
Thank you. Thank you. So we had the great big initial bill. We have a proposal of an amendment that simply allows a provider, a licensed provider, to prescribe for investigational purposes. But am I understanding from what you said that if it is the subject of a proper investigation under our current protocols, that provision is unnecessary because they already have that ability?
From my understanding, unless I am missing something dramatic, yes, ma'am, that your understanding is correct.
Thank you.
Yes, ma'am.
That's very helpful.
Yes, ma'am.
Representative Woods and then Representative Drew. Oh, I'm sorry. Oh, Representative Palazzo.
Thank you, and thank you for taking my question. So you mentioned that you can share some information specific to ibogaine. We already heard about some side effects from Representative Lucas, and Prime Sponsor talked about some positive effects. So could you share more?
Yes, sir, I'd be happy to. So this particular experimental substance, it is known to target what is called a serotonin receptor, and I know a lot of you on this committee know what that is. And that is a quote-unquote feel-good receptor. And so the theory is that it may be how this medication in some circumstances has been thought to help with things such as depression and anxiety. Another receptor that this acts on is what's called an NMDA receptor, where glutamate, which is an toxic chemical in the brain acts, and that is also a known target in schizophrenia. There's theories behind that this might be why the drug is helpful, but in other studies, it shows that this particular substance is displaced off that receptor. So it's not even known if that receptor is or is not part of the benefit, supposed benefit of this drug. Sir, we learned a lot about the psilocybin studies, that preceded this. I was at University of North Carolina at Chapel Hill, and we were participants in that study. And we learned a lot from that medications or substances that are what we call dirty, for lack of a better term, so don't have that specificity and selectivity, it can open itself to a wide variety of side effects. And so again, I just hesitate, sir, to have the legislation involved in anything to do with this.
Representative Kesselring.
Thank you, Mr. Chair, and thank you for taking my question. Actually, kind of this might be framed more as would you know that it is a Class 1 substance, which New Hampshire does deem to be illegal. We learned this with psilocybin, that it is not legal to do clinical trials in the state unless it becomes legal through legislation. So this would be required in New Hampshire for legislation. Legislation would be required for us to be able to move forward with clinical trials in New Hampshire.
Understood. Yeah.
I see his hand up here, over here. Oh, Representative Lucas.
Thank you, Mr. Chair. So, Representative Kesselring sort of started where my brain's going right now. I think I just heard you say that we already have the ability for investigational trials for Ibogaine in the state of New Hampshire, but then it's a Schedule 1 drug, so it's not possible. I'm trying to understand where we fall on that.
Right.
Currently.
No, I understand. I understand
Yeah.
what you're saying, and I
Yeah.
think I share some of the committee members, confusion around what this amendment is and is not saying. So it sounds like Representative is saying that if this is a Schedule 1 substance, then that
Mhm.
type of amendment would be necessary to allow that. So
Mhm.
if the scope of this were to limit that, I don't really have a comment on that. My concern is the involvement in legislation in a clinical trial.
Mhm. Thank you.
Yes, you're welcome.
I see no other questions. Okay, thank you.
Okay, thank you.
No one else has signed up to testify on 1772 FNA. Oh, I don't have it. What's your name, please? Okay, may have been. Okay, I'm sorry, I got mixed up with the other one.
That's okay. Thank you.
My apologies.
No, thank you, Chair. For the record, Sue Hamola, Sam, New Hampshire. I appreciate all the testimony that I've heard today. I appreciate Ref Moffitt's empathy for trying to do things to help veterans with PTSD or active duty people with PTSD. The one thing I do want to say is I just want to underscore that Ibogaine is a federally legal Schedule 1 substance. So what we're actually doing here today is we're saying, should we flaunt federal law to test a psychedelic substance on a vulnerable population, using the right to try as a reason for that? And I just want to underscore that right to try is not a free-for-all to do anything people want to try. It is a federal legal Schedule 1 drug, and the fact that we're talking about this at a state level is really indicative of how far we've come on flouting federal law when it comes to Schedule 1 drugs. Ibogaine, as it's mentioned before, I won't repeat the things that we've said, but there's been a total of 33 Ibogaine-related deaths publicly reported in scientific literature to date so far. And one of the places that's really pushing psychedelics into the state arena is the Psychedelic Science Funders Collaborative. And I'll just briefly say this again because I told you this before when we were doing psilocybin, we're having the discussion on that bill. But that's basically a handful, about 20 Silicon Valley families who've invested hundreds of millions of dollars into psychedelics. And the goal is to get them legalized at the state level, much like we did with marijuana. This is getting pushed. The reason it's getting pushed with veteran care is because they identified, quote, that veterans are, quote, the most sympathetic group in our country. I'm a vet. My husband's a vet. 3 of my children are currently serving in the Air Force, Marine, and Navy. I'm very empathetic to people who have PTSD. I've known people who've had PTSD. But all I want to say is that this should not be happening at the state level. And we should not be doing this using veterans. And so I just wanted to draw that 40,000-foot viewpoint out just a little bit and underscore what we're really talking about today. Thank you.
Thank you. Any questions? Representative Palazzo.
Thank you, Mr. Chair, and thank you for taking my question. So I guess if you know anything about specific patterns, how people abuse this medication. For example, my understanding is if opioids are used to treat pain, most of the deaths happen if people continue to use medication and abuse it in future. So with ibogaine, those 33 deaths, do we know if it's like from one-time consumption, or is it also for people who got addicted to it and abused it in more prolonged period?
Thank you for that question. So I emailed you all testimony, and there's a link to that, to the study that talked about the 33 ibogaine-related deaths. And I believe one of the major issues are the fact that, as it's been said before, it causes, it's particularly problematic for people who may have underlying heart troubles, known or unknown, because it causes cardiac arrhythmia and irregular heartbeat, things like that. So while I don't know if that was because people are abusing it, although I will say that this past October of 2025, we have an American chess master who was 29 years old who died of an overdose, and it was a polysubstance overdose. And in his system, there was ibogaine, because when you combine it with other things, it was also kratom and all kinds of things that really just wreak havoc on the heart, or cause arrhythmia. So I do believe that a lot of the cases that were cited, the 33, had to do with heart-related issues and not necessarily because they abused the drug and took too much or things like that.
Okay, I'm seeing no other questions. Thank you.
Thank you.
Okay, does anyone else wish to testify on HB 1772 FNA? Seeing no one, I'm going to close the public hearing on that bill and reopen the public hearing on HB 1706 FN, and resume testimony. And somebody wants to let the folks out in the hall know that we're going to reconvene. Yes.
Could we possibly do next with the person named Bill, who I think is the other program administrator? Because people kept saying, Bill's going to talk about that. And I'm assuming it may be something
From IINE, right?
Yeah.
Okay, thank you everyone for your patience. It's been a very busy, compact day. But we are reconvening on 1706 FN, and I'd like to ask William Gillette from IINE to come forward, please. You need to hit there you go.
There we go. Thank you.
All set.
Thank you. My name is William Gillette. I'm the Director of Public Policy and Advocacy for the International Institute of New England. While I have written testimony that I will provide to you, I'm not going to read that because of some of the testimony we've heard today. And also, you've heard quite a bit about the resettlement organizations. We're one of two resettlement organizations in New Hampshire. The International Institute is one. We work primarily out of Manchester, and Accentria, who you'll also hear from, that works primarily out of Concord. I'm going to give you a little bit of context, though, because I want to respond to Representative Corcoran's lengthy testimony. And I did not see his testimony until about 10 o'clock this morning, so I haven't had a lot of chance to go through it. But I will make an offer to the committee. If you would like, I would be happy to give you a full rebuttal of that testimony, although it would take me about a day or two to provide it with the same level of detail.
You have about 2 minutes
Yeah,
left.
exactly.
So don't do it today.
Well, I'm not going to do it now, obviously. Let me give you context. I was the chair, a member of the board of the International Institute from 2008 until 2017, when I was living in Manchester, and the board chair for 7 years of that time. While I was on the board, I was originally the president of Riverstone Resources in Manchester, which is a multinational, multi-billion-dollar insurance organization headquartered in Manchester. And then for 4 years subsequent to that, I was the dean of the business school at Southern New Hampshire University. I tell you this because I'm very acquainted with the business community in New Hampshire. What I heard from Representative Corcoran and some of the other testimony was a very bleak picture of refugees, and that is directly and completely contrary to my experience working with refugees for a number of years in New Hampshire, supporting their businesses, working with them as entrepreneurs. They are the most determined people I have ever met, and because of the opportunity that this country has given them, they are frequently the most patriotic people that I have ever met. They, as a direct result of their situation and their determination, they typically, to the extent that they are accessing public services, they access them for less time than a typical domestic person accessing public services. And let me just read one piece from a recent Wall Street Journal study, that well-known liberal rag, about refugees. Refugees commonly start out in poverty when they arrive in the U.S., but catch up quickly, according to studies of the U.S. Census Bureau data. They have high rates of entrepreneurship and over time produce more in tax revenues than they receive in government benefits. A number of studies, census data show. And finally, just to give you an example, in New Hampshire, currently, we've talked about healthcare. There are 5 healthcare, home care businesses started by Bhutanese refugees here, as well as an adult care center here in Concord. There are numerous examples from all organizations of businesses that benefit New Hampshire today, and that, as my colleague Henry Harris talked about, support the workforce. Thank you.
Thank you. Representative Weber and then Representative Woods.
Thank you. I'm trying to write quickly, but I seem to recall having read something a while back, and I don't know whether this is something you're acquainted with or not, but can you speak to those established businesses already established here in New Hampshire that employ workers from this program? Because I seem to recall having read something about an employer who specifically sought out refugee employees because they were particularly suited, and I wonder if that rings any bells in your experience.
I'll answer it 2 ways if I can. I'm not sure of the specific article or study that you're talking about. As my colleague mentioned, we have worked with over 150 businesses in the state over the last 10, 15 years. It is very common for a business that hires one of our refugee clients to then seek to hire more of them. They are typically, again, it's the determination to succeed and the appreciation of the opportunity they've received here. So there's a reason that we work with so many businesses, and most of them are repeat customers, if you will. Now, the businesses that are started by the refugees, they're all over the map. I mean, not surprisingly, they are grocery stores, they are restaurants, but as I mentioned, they're home care agencies, they are insurance agencies, real estate agencies. So all of them are employing people in their work. Some are employing other refugees, some are employing other residents of New Hampshire.
Thank you.
Representative Woods.
Oh, thank you. And thanks for taking my question. We've heard about the resilience of this kind of a program nationally as well as here. We have data, at least I have data nationally, hard data, but it seems to, do you have any hard data for New Hampshire that we can sort of sit down and look at on a comparative basis? We've heard by voice.
Sure.
But, is there something that we can put in print so that we can all take a look at?
There is some. There is not as much as there might be, obviously, at a national level. When you ask specifically for hard data, what exactly would you like? There is, and actually, there is a UNH study that was done a few years ago. There is, and by the way, that study found 86% of New Hampshire refugees arrived with some schooling, 38% had at least a high school education, 78% were employed within 8 to 24 months, and 67% had learned English, or some English. I can provide you after the hearing with more specific information. Yeah, okay.
Anyone else? I see no one else. Thank you.
Thank you.
Also signed up to speak is Patrick Binder from Manchester, representing New Hampshire First. I noticed, sir, you checking in on us periodically. Thank
Yeah,
you.
I want to make sure we didn't miss this.
Thank you for sticking around.
I think this is the most important issue of our day. Immigration in general, refugee program is just part of that. Once again, my name is Patrick Binder. I live in Manchester. I'm in Matt Drew's Ward 10. Thank you for having me here, committee. I am the director of New Hampshire First. We are a citizens advocacy group. We exist for one reason, and that is to ensure that the state of New Hampshire, that every effort of the state of New Hampshire is directed towards citizens, and that means non-foreigners, you know. So this bill is pro-citizen because it stops the forced association of New Hampshire citizens into a program that they never asked for, they never asked to be taxed for. What this bill does is it simply ends the state's participation in the federal program, which is also on pause currently, for the most part. It does not ban these private charities and church groups from continuing their work, which, as we heard, that some of them have been doing for over 100 years. It doesn't stop any of that. It doesn't stop people from moving here. It does not prevent legal immigrants from moving here on their own. It doesn't even stop the federal laws that enable these traitorous NGOs from trafficking these people here. It doesn't stop any of this. It just means that my state of New Hampshire will no longer take part in this, which I think is the moral thing to do. And here's why. You're all probably familiar with Article 2 of the New Hampshire Constitution. It lays out natural laws. And then Article 3 goes on to say why we form a society to protect some of these natural laws. And we give up some of our natural rights to get this protection from society. And as we see in the preamble to the U.S. Constitution, we do this to secure the blessings of liberty for ourselves and our posterity. When you start taxing U.S. citizens to bring in foreigners, that is reason for rebellion. That is the classic Article 10 behavior. This needs to end now. We need a reform across the whole U.S. to put these to an end. Just a little bit of data. As was mentioned before, Manchester had a report in 2005. Manchester, only 8% of New Hampshire's population has taken 80% of the refugees. So everyone that doesn't live in Manchester, I don't want to hear it. You guys do not know what you're talking about. Mayor after mayor has called for an end to this. Back in 2005, it was Mayor Gintis, and he complained, as well as Ted Gassis later, that the New Hampshire Office of Refugee Resettlement actually refuses to work with the municipalities. At that time, back in 2011, Democratic Senator and former Alderman Pat Long said, enough is enough. We need to stop this program. This is a bipartisan issue to get this to end. And it's really only the people that are in these cities that are feeling this, that are suffering from this. In which way? Our cost for English as a second language has gone up from 1% of our student population in 1990 to 15% in 2010. And now it is nearing 25% of all Manchester students are in English as a second language. Meanwhile, during that same time period, poverty has doubled. Poverty has doubled in that same time period. Let's see where we are here.
If you could start wrapping up, please.
Sure. earlier today, the lady from the Council of Churches said something about a moral obligation, and she started talking about religion. I think that we have separation of church and state for a reason, and these are private charities, religious groups that they can do it voluntarily. If no one wants to donate to your church to do this, that's because New Hampshire is saying we don't want this. Using the force of government to force me to bring in workers who are going to take housing and jobs from my family and my future kids is treasonous. Put an end to this now.
Thank you. Any questions? Representative Palazzo.
Thank you, Mr. Chair, and thank you for taking my question. So, previously we discussed a lot about financial implications. So, you are shooting for long-term positive effects of this bill, but would you still support it if it would cause short-term increase in some taxation? For example, if people will still come here and we will see more unpaid medical bills in hospitals, maybe a state would need to cover some of it. So what are your thoughts on short-term paying if this became a law?
That some of the claims that this would cost a little bit, like some millions of dollars more to the state to end. Is that what you're saying? Or my thoughts on that?
If refugees would still be coming here in certain amounts, and for example, not able to pay for their medical bills, and we won't have that federal funding, it might increase our state or local taxes. So, would you be still okay with?
Yeah, totally worth it. But the data that we have says that when a state stops participating in this program, the federal government tends to send fewer refugees here. So the problem actually goes down over time. In addition, as fewer services are available here, they simply go to where they have family and cousins and tribal members in, Lewiston, Maine, not even far away, or Massachusetts, into one of the many, many, many states that do this. And it's my opinion that if we're going to have 50 states and have an experiment of 50 states, we got to have some that just don't do this, right? We can't all be forced to take the world in. And I want New Hampshire to be a place that says no to this and says we're actually going to focus on our own citizens.
Representative Woods.
Oh, thank you, Mr. Chair. I'm just curious. There's, at least to my perspective, there's some confusion between immigrants and resettlement. Could you offer how you differentiate that for us?
Yeah, so I would say immigrants in general is a broad term, and I'm not sure if the refugees fall under that, that well, because as far as I'm concerned, they are trafficked here. They don't get a choice in where they go. So they apply to a program and then they are human trafficked here, and these people are behind me, the NGOs, are making a lot of money doing it. It's similar to other types of human trafficking. They make money doing it. I don't know, does that answer your question a little bit?
I just wanted your thought.
Okay.
Hey, anyone else? Saying no one else. Thank you. Also signed up to speak is Amy Moore from Essentia Care Alliance.
Good afternoon. Thank you for the opportunity to speak. I know there's a lot of people speaking, so I'm not going to repeat a lot of what Bill and Henry said, because that's a lot of some of the data, the facts that I would share. My name is Amy Moore. I'm the Vice President of External Relations at Essentia Care Alliance. We are a mission-driven nonprofit that's been around for over 150 years. We work throughout New England and work with people from literally birth to death, adoption, foster care. I actually, for 17 years, ran our in-home care program, which worked with people who were living with a disability, aging, veterans throughout the state of New Hampshire. So again, I'm going to keep this brief because you guys have heard a lot, and I don't know how you do this all day. I give you a lot of credit. I'm impressed. But just to rebut some of what I've heard is I think there is a lot of confusion around immigration, right? And refugees, and there's a lot of coming here legally. Refugees are the most highly vetted population in the country. What they go through, as you've heard, takes 18 to 24 months, sometimes 20 years. We also know that tens of billions of dollars in tax revenue comes in, less than what they receive in benefits. That's another, there are multiple federal studies on that. But I do want to speak quickly to the workforce piece because I think that's important and one that I can speak to. We know our workforce reality, especially in New Hampshire. I was on a commission for Governor Sununu years ago, looking at long-term care and what was coming, right, of people aging. Again, I've spent the last 17 years working in healthcare. I currently serve as board president for the Home Care Hospice Palliative Care Alliance of New Hampshire. I can tell you that the workforce shortage is not theoretical. Patients are hurting right now. I think some of you know that. So New Hampshire being one of the oldest populations in the country and healthcare employers across the state, hospitals, nursing homes, home health agencies, which I ran, are struggling to fill these essential positions. And as you've heard from IANE, who has a fantastic LNA program, we work hard to get people into jobs. That's what they want to do as quickly as they can. And in 18 years, you can imagine some of the stories I've heard of what people went through to get here, right? It wasn't a choice. It was a safety issue to get here. Again, highly, highly vetted. So just going off of that, when we talk about restricting refugees, we're not just talking about turning away families fleeing violence and some awful stuff that none of us have had to deal with. We're talking about making our healthcare crisis worse, putting additional strain on an already overwhelmed system, and harming Granite Staters who rely on services every day. Bringing in refugees is smart workforce policy, sound economic policy, and responsible healthcare policy for New Hampshire. It's not about law and order. Refugees follow the law more thoroughly than most anyone, and not about fiscal responsibility because we know that they strengthen our economy. So that makes me, whenever I look at all of that, I'm like, so what are we trying to do here, right, with this bill? But I think, in trying to figure out what this bill is here for, I think, frankly, if we just look into the sponsors, the last person that spoke, it helps me to make some sense of it, because people that believe in child labor being legalized and other things, that might answer some of my questions about why we're here today.
Thank you.
Thanks.
Are you taking questions, ma'am? Or?
Oh, I'm sorry.
That's okay. Representative Weber.
Thank you very much, and thank you for taking my question. I just wanted to be sure I heard you correctly. With respect to the tax revenue produced by refugees and the benefits used by refugees, which is higher and which is lower?
What is higher is the revenue that comes into our country from them, and what is much lower is the services that they actually use.
Okay, because I thought I heard that backwards, so I just wanted to be clear. Thank you very much.
Yeah, sorry. I thought that could be me too.
Representative Kessler.
Thank you, Mr. Chair, and thank you for taking my question. I had a thought when you said something, and you said said that it takes a lot of time to get here. So if they're looking to flee these countries, why is it that it takes so long to get here?
Okay, I'm going to say this. I agree. This is weird, but I do agree with a lot of what's been said when it comes to our immigration system being broken. And I think that is where some of us can come to agreement. It is broken. And what happens is that because that vetting system is so long, takes so long, and getting through all of that, people live in refugee camps. I have people that I've met in 18 years of doing this work that I had no idea, because I'm a privileged white woman, but they've grown up in refugee camps waiting to come to a safe space, because all they want to do is get an education, have their kids go to school, right? And for them to work here. And I also just I think there's, because of some of the rhetoric around people coming here, a lot of the people that come here are like doctors, engineers. Like, please don't diminish any of that.
Seeing no other questions, thank you.
Thank you very much. I do have copies.
Oh, thank you. Also signed up to speak is Nate Dwyer from Manchester.
Hi, I'm Nate Dwyer from Manchester, and I'm here to speak on this bill. I very much agree with the previous speaker about the increase in tensions that have been recently and this anti-immigrant sentiment. But I pose to you that the reason for this anti-immigrant sentiment is not that the American is somehow like innately anti-immigrant. In fact, America is one of the least racist countries in the world. If we look not at necessarily our history, but on in many studies, including a study on if on the top 3 things you wanted a neighbor, one of the top 3 things across the world that was wanted for a neighbor was somebody in their race, but only about under 5% of people in America answered that way. This is not true for many other countries. So in fact, if we're going to preserve our cultural value of being in a cohesive nation, one that values people based on content of their character and not color of their skin, we need to make sure that we don't encourage programs that start to differentiate between people based on the color of their skin or what nation they come from. This refugee program, along with other things that the United States government does, and in fact begins to separate, begins to benefit people who come here. Benefits people who come here but do not have, but have not, are not citizens. And this is, sorry, I'm losing my train of my thought. And ultimately, by benefiting non-citizens, it creates wedge issues which encourage people to, instead of saying, oh, we shouldn't be giving them handouts, we instead say we need to be keeping them out entirely. The answer to this is to stop giving out handouts to people because of the color of the skin. Thank you.
Thank you. Thank you. Also signed up to speak is Dylan, I believe it's Hoey.
Dylan Hoey, yeah.
From NHA, New Hampshire Air.
Yep.
You can tell us what that means.
Yep, will do.
Thank you.
Hello, Chairman, members of the committee. My name is Dylan Hoey, and I am the director of the New Hampshire Alliance of Immigrants and Refugees, otherwise known as New Hampshire Air. And prior to joining this organization, I served as a U.S. diplomat with the State Department. And in that role, I adjudicated thousands of visa applicants and evaluated their potential risk to U.S. national security. And I also served during evacuation operations in conflict zones alongside U.S. diplomats and service members. And I'd like to address 2 concerns underlying this bill, the first of which is security and vetting. As others have said, refugees are arguably the most thoroughly vetted category of people who enter the United States. I'm going to emphasize this. First, applicants are screened against the most robust biographic databases in the world. Applicants then undergo biometric checks by the FBI, an in-person interview with USCIS, a social media review for fraud indicators, and a medical screening with a panel physician. While the separate category, special immigrant visa applicants from countries like Afghanistan must also receive a letter issued under the authority of the chief of mission, oftentimes the ambassador in the country, attesting to their employment with the U.S. government. The individuals from state, USCIS, and supporting agencies who help administer these programs are national security professionals who are dedicated to their mission and are trained to identify fraud. Indeed, anyone who has served in a security or law enforcement capacity understands that your professional reputation, and by extension, your career, hinges on the judgment you show while making these determinations. The second question I'd like to address is why we admit refugees at all, which has certainly come up here today. The simple answer is this: the United States has consistently seen resettlement as a matter of national interest. During the Cold War, shortly after World War II, we admitted hundreds of thousands of European refugees. During the Cold War, our leaders understood that we had a moral obligation to provide shelter to those who cooperated with us, which led to the admission of hundreds of thousands of Southeast Asian and Eastern European refugees. That obligation has been honored across Republican and Democratic administrations for nearly half a century. And when we have recognized a compelling humanitarian obligation, we have extended resettlement to others. This includes refugees from the DRC, which has experienced nearly 30 years of conflict, and survivors from the Bosnian genocide, many of whom were resettled here in New Hampshire. As a former diplomat, I believe this is an incredible quality and it is part of what makes America great. Secondly, it has contributed significantly to our national security by shaping people's perceptions of the U.S. as a welcoming and diverse nation. Dismantling the state's resettlement program would be short-sighted, and in my view, a tremendous shame. I encourage you all to vote ITL. Thank you.
Thank you. Any questions? Representative Drew.
Thank you, Mr. Chair. Once again, could you briefly describe how your organization is funded and where that money goes?
Yep. We receive 0 New Hampshire state or federal funds. We're entirely funded by private donations and foundations.
Anyone else? Okay. Thank you. Oh, follow up. Okay.
Thanks, Mr. Chair. So my second question is about vetting. Let's assume, since you mentioned the DRC, that you have a refugee from the DRC. They're currently living in a refugee camp outside of Congo.
Mm-hmm.
How would you go about vetting a person like that? You're never going to get a response from any of the factions inside the Congo, I would assume. So what is the process for vetting that person?
Mm-hmm. That's a fair question. There are restrictions on what I could say in terms of information I can disclose about that vetting process, understanding that it's a matter of U.S. national security. I would encourage you to look up the agencies that are involved in the vetting process generally. With that being said, someone spoke earlier, Representative Kesselring, you asked, why do people end up waiting years sometimes? Well, for example, in Doha right now, there are about, I believe, 10,000 plus Afghans who are waiting to be resettled. They were evacuated out of Afghanistan during our drawdown. They haven't been resettled for one reason or another. But that being said, it's likely because they have not overcome some of these concerns that people have had, and they cannot overcome those concerns. So I'll leave it at that.
Representative Tejas.
Thank you, Mr. Chairman. Thank you for taking my question. So, yeah, trying to eliminate that people are in camps for a long while, expanding on what you just said. I think I remember in the past hearing there's 10 or 100 times the number of people who are displaced waiting somehow in process versus the number of people who actually eventually get resettled. So can you elaborate on that, sort of the pipeline a little more? Like, how is it that people are in refugee camps and come here versus whatever their country of origin might be?
Yeah, I didn't specifically work on refugee resettlement or USRAP, but I can say that they have to be vetted, or they apply with the U.S. Embassy or UNHCR, and then, as I mentioned, DHS, specifically USAS within DHS, have a refugee officer that would conduct that interview. There's just extensive vetting that people do not know about that goes behind these determinations, and that is often why there is this kind of jam in the pipeline, so to speak.
Representative Kesselring.
Thank you, Mr. Chair, and thank you for taking my question. It's actually kind of a question that really hasn't been asked in this framework. So since the federal government is involved in all of this, and this bill that we're looking at now would take away the state's ability, wouldn't the federal government just work with organizations like everybody in this room that's talked and just go directly to them instead of going to the state?
I mean, to my knowledge, the refugees are assigned to nonprofit organizations that are resettling, and then there are funds that are coming from the federal government through the state health agency that are then assigned to NGOs. But that's not my area of expertise. I think other organizations here have already spoken to that.
Seeing no other questions. Thank you.
Thank you.
Also signed up to speak is Suzanne Corby. Did she leave? Yeah. Also signed up to speak is Eileen Brady.
Thank you, Chair McDonald and members of the committee. I'm going to be very brief, and I'm going to be very personal. My name is Eileen Brady. I live now in Nashua, but I was born and grew up in Manchester, and am a member of the Sisters of Mercy, who have worked with many immigrants and refugees for years. And I personally know, and I'm happy to know, lots of refugees, also through my work as a social worker. But I'm going to tell a family story. My dad's mother died when he was a young boy, and he was taken in by his aunt and uncle. And his uncle was an Armenian refugee. I don't know if he was called that back then. It was the 1920s. It was pretty messy. But he came home one day when he was 16. His entire family was exterminated. And the recognition of those murders was only recognized in the last 10 years in this country, what they went through. He came as an Armenian, learned English, worked immediately, and raised my dad. And when people talk about refugees changing the culture, that changed our family significantly. The food got a lot better, for one thing. It was wonderful, spicy food. And his character, his ethics, his story of why he came here was so important. His 3 sons served in World War II. My dad did too. He was a huge influence, and his descendants have contributed a lot. One was a Republican speechwriter. One was a Democratic candidate in Manchester. And lots of the others have done wonderful things. It was a huge investment for the community to take him in and to let him do what he could do the best, which was to be a wonderful family man. He had to reconstitute his family. It was all gone. So I just want people to know that there's many, many stories out there. And I highly recommend Becky Field's work on all the different groups that have come to New Hampshire. My mother grew up in Manchester in a highly diverse community, lots of languages. And that's not different. There's just more people, so there's more languages. But I'm very grateful for having him in my family tree and being able to speak to you today. Any questions? It's kind of personal stuff, so you might not have any. I don't have the statistics.
Representative Drew.
Thank you, Mr. Chair.
Yeah.
In your personal experience, did your, I'm not quite sure how he relates to you, but your father's
He's my great-uncle.
Great-uncle.
Yeah.
Did he receive any benefits of any kind from the U.S. government when he immigrated here?
I don't know, because I don't know the history, and I know the attitude towards anybody coming in was a lot worse then, even than now. So I don't think so. I know he was helped by church people. He was helped by, that was when they were excluding whole countries from, and I think because of particular people that the Armenians were granted, because people knew what happened to them. And they were probably the Armenian church was, because that's, there's a great movie that I saw, I can't remember the name of it, something about promise and all the, I don't know, it's about the Armenian genocide and all the people who came here. So if I resaw that, I would probably know what the resources were then, because that family had a similar path to ours.
Representative Woods.
Thank you. Just a quick one to know. Becky Fields, is that the Concord photographer you're referring to?
Yes.
Thank you.
Yeah.
Anyone else? Seeing no one. Thank you.
Thanks for your time.
Also signed up to speak is Kathy Brunette. That's fine.
Thank you, Chair, and for all of you to be here. My name is Kathy Brunette. I'm here as a private citizen. I'm also on the board of Overcomers Refugee Services, and I've been a volunteer for several years with that organization. I've been involved in the application process to the state of New Hampshire, DHHS, for some of this federal money. First, I think I want to just kind of give you an overview. There are two resettlement agencies. You've heard from them today, IANE and Accentria, and then you've got other groups that help people who are past that first year, and that's what Overcomers and BCNH do. We applied for a refugee support grant, and as I understand it from the comments earlier by the state office, that would be entirely eliminated should New Hampshire get rid of their office, because it's not actual resettlement money, but it's refugee support money that the state gets to about $1 million. I have a copy here of the request for proposals for the grant that we applied for. It's online. Representative Cochran seems to know how to Google, so he can find that. I had a prepared speech, but this morning I also read Representative Cochran's statements online during my breakfast. It was not a good breakfast. I was struck by a couple of things. First, he was very clear. He does not care. He said that in his statement. He only cares about the citizens of New Hampshire. Well, guess what? We don't have citizenship in New Hampshire. A New Hampshire citizen, by definition, is a resident who plans to stay here. Who does care, though, is businesses in New Hampshire, manufacturing, healthcare, hospitality. Decent people care. Many of them showed up today and testified. And we also have a law that cares, the 1980 Refugee Act, which is what all this money is coming through. Representative Cochran said he didn't see any evidence for what good refugees do to New Hampshire. I don't think he personally looked, because if he had looked, he would have been talking to the refugee support agencies. He would have been talking to refugees themselves. He would have been talking to some of my friends, perhaps the Ukrainian family in the Seacoast who came here in 2022, who started their own handyman business, the mother works at the dining hall at UNH. The daughter works at Starbucks and is applying to college. They are paying taxes. They're paying into Medicare, Social Security. They are covered by the support contract that BCNH and Overcomers has, and IANE, and they got help from two of those agencies.
We can start wrapping up, please.
Okay. They do not have a path to citizenship, so all those taxes will benefit the rest of you if they have to go back to Ukraine. And Senator Cochran didn't speak to one of the case managers at Overcomers who was born in a refugee camp, lived there till the age of 17 when her family was vetted for 2 years and came here, went to college, and became a social worker and joined Overcomers to help others. I will close out by saying you can't legislate human decency out of existence. I strongly urge this committee to vote to kill this bill. Thank you. Any questions?
Thank you. Any questions? Seeing none. Thank you.
You're welcome.
Okay. Overcomers Refugee Services. I don't think I can pronounce the name. Starts with a C. I'll let you pronounce your name, sir. I'm sorry. If I even attempt it, I'm not going to do it justice. So.
All right. Thank you. Thank you so much.
Sorry, 1 second. Can you spell your last name? It's not clear on the...
Kigugu. Kigugu. Thank you. Good afternoon, Chair and member of this committee. I'm here as a refugee. People have been talking about refugee and giving testimony about their grandpa and uncles and everybody, but I'm here as a refugee. So I'm gonna give a personal story, not somebody else's story. I came here in 2006 from Rwanda. I came here when I had my college degree. I have a job back home, supporting my family, enjoying my country and food and everything else. because of the 5 reasons people mentioned: fear of persecution, war, violence. I have to leave my country. So I came here as a asylum seeker. My family, my 6 children, my wife came 1.5 years after. In 1 year that has been waiting for my family, I had 2 jobs in plus of going to school to learn English. In 2013, I started Overcomers Refugee Services. Going back a little bit to my family, so my 4 children already graduated from college. They are now working. They pay tax. They don't have any federal or state benefit. Myself, I don't have any federal or state benefit. I pay tax like every other citizen. My 2 children, youngest children who are in college, they don't have any federal money to pay for their tuition. We take the loan, and whatever I get from my pay, I pay half, and they take loan, and we pay after they graduate. So in 2013, I started Overcomers Refugee Services, which I'm a founder and executive director. So Overcomers Refugee Services has been really doing a good job, helping other refugees like me to adapt and become New Hampshire contribute. So we help them to apply for a job, help them with the cultural orientation, help them to connect with businesses and other providers. So we are a kind of resource center. We are solicited by the hospital, businesses, and other providers to get the workers. Our people come to us when they are looking for a job. We connect with the businesses. I wish the business people should be here and testify. When I used to work at the Centria as employment specialist, I remember going to connect with the businesses, and they were saying, oh, we cannot hire a refugee because they don't speak English. And I was telling them, can you please try one person? After 1 week, they would call me and say, could you please send us another person? After 1 week, they call me again, can you send us another person? Now that's how I start. We have so many people who work very hard. We didn't come here to get the benefit. The refugee work very hard. As I said, I wish the business people could be here. The question is, I heard people saying that the refugee take their job. We don't take people's job. My question is, how can somebody hire someone who doesn't speak English when there's someone who does speak English? How can somebody give a house to someone who has money, who has been here for so long, versus someone who's a refugee, who just arrived? That's the question people should be asking themselves. They hire refugee because there's a need.
Could you start wrapping up, please, sir?
Yes. So briefly, we are here. We feel that the people feel the job, not taking people's job. We're here to help the economy to grow. We're here to help our family. So people, refugees, are now living in fear. We came here to seek the safety for our children. Now we're living in fear because of this policy's change. Now we thought maybe it was just the federal issues. Now it's coming to the state. How people can perform their job collectively when they are not healthy, emotional, and mentally. So let people work when they feel stable, when they feel safe, when they feel like this is our state, this is the place where we live in. We work at the hospital, we clean the room after an emergency room, we take care of other people at the nursing home, restaurant, hotels. That's why people, the visitor come in New Hampshire, because there's people who work in a hotel, clean the hotel. The hotel looks good. That's how our mother, our grandma goes to. Thank you so much.
Yeah, thank you.
Should continue.
Any questions for this gentleman? Seeing no questions, thank you.
Thank you.
Also signed up to speak is Kevin Boardman.
Hi, everyone. My name is Kevin Boardman, and I am a proud member of the Southern New Hampshire Democratic Socialists of America. And I, as well as our chapter, oppose HB 1706. How dare you even write something like HB 1706? How dare you even think revoking funding from refugees? These human beings are not criminals. Funding them is not a waste of tax money, of federal tax money. It is actually, despite what some of you overly racist state reps think of immigrants, an honor that we have this program here that is used to help those escaping war, poverty, famine, and disease. The United States of America is supposed to be a beacon of light for those looking for a better life for themselves and their family. I am close friends with many children of political refugees, those who have escaped genocide, forced famine, and attempted targeted government assassination. These children are now adults in their late 20s and early 30s. They are therapists, teachers, engineers, manufacturer workers, some of them even pursuing doctorate degrees, and more. But most importantly, they are good human beings. All of my friends who are children of immigrants and refugees are amazing people. They are not disease-ridden career criminals like Travis said earlier. They make not only this country better, but this state better. It would be a disgusting act of racism and xenophobia to let this bill pass. We have to realize the problem with this country is not the immigrants and refugees, but the oligarchs. The billionaires that many of you politicians are funded by, who hoard resources from everyday people and continue to expand their wealth. All the while, people die on our New Hampshire streets from starvation and freezing temperatures. The billionaires who control the healthcare in this state while people die from not being able to afford treatment. The billionaires who control the property in the state, making prices through the roof for their own benefit while people can barely scrape by to pay rent. It is not immigrants and refugees causing these problems. It is the billionaires and politicians who align themselves with these billionaires that are the problem. In 2025, Travis Cochran said, "Violence isn't associated with the presence of guns, but the presence of African Americans. Blacks commit violent crimes at a 5 to 10 time rate of whites. I will wear a black t-shirt on Friday, June 6th to help make people aware of the fact that crime is predominantly caused by African Americans." Also, I wish he was still here because I would ask him to say this word. Also, in 2023, he tweeted on one of his Twitter accounts. He has multiple Twitter accounts because he's too cowardly to actually say what he believes. He encouraged people to use the N-word as a matter of principle on one of his Twitter accounts. I take personal offense to both of these statements as someone who has a black sister-in-law and a mixed niece and nephew who are the grandchildren of immigrants and refugees. It is clear where the motives lie when Travis wrote this bill. They are motivated to protect. They are not motivated to protect the people of New Hampshire. They are motivated by Travis's abhorrent racism. I strongly oppose HB 1706. I will not thank any of you for your time until the co-sponsors of this bill reconsider their position on this issue, or all of the co-sponsors of this bill resign from office. Thank you.
Any questions? No questions? I think you made yourself pretty clear. Next up is Matt, I believe it's Coulon.
Yeah, you got it. My name is Matt Coulon. I'm here to represent myself.
Sorry, again, not clear. Can you spell your last name for me?
Coulon. All right, I'm here today to testify in support of HB 1706 to repeal refugee resettlement and terminate the state's monetary contribution to these programs. This is our state's version of the fake daycares and fraudulent shell businesses which have made headlines in Minnesota and Maine recently. I believe the magnitude of fraud, waste, and abuse carried out through resettlement agencies, NGOs, and nonprofits to be novel and gargantuan in proportion, perhaps bigger than anything we've seen in American history. As a result, refugee resettlement has contributed to New Hampshire's housing shortages, overwhelmed our welfare, healthcare, and food assistance programs, added additional tax burden to local taxpayers, and affected our high trust civil culture in immeasurable ways. Additionally, the CEOs and assorted operatives of resettlement agencies appear to be collecting multiple six-figure payouts through a confusing maze of entities funded largely by federal grants and other public monies. The depth of fraud being carried out is a major nationwide scandal which is unfolding as we speak and won't be going away anytime soon. HB 1706 gives the state of New Hampshire the opportunity to lead the way in ending its involvement and enablement of widespread institutional corruption. So I urge the committee to be sensible and pass the bill. I thank the committee for your time, and I thank the prime sponsor of the bill for filing it. And yeah, that's it.
No applause, please. Any questions? Saying no questions, thank you. Also signed up to speak is Patience Corbett.
Hello, my name is Patience Corbett. I am also a proud member of the Southern New Hampshire Democratic Socialists of America, and I'm here to oppose the white nationalist garbage known as HB 1706. Also, as a Manchester resident, I encourage everyone to dismiss the pageantry around my city. Refugees make Manchester great, and they make a huge contribution to our local economy. We have a dying economy in Manchester, and I think a lot of the witnesses here have told you how important refugees are to that process. What I find most interesting about this low IQ bill is the cruelty and complete disregard for common decency. It should be noted that all of our refugee resettlement activities are federally or privately funded, and we do not spend a single local tax dollar on any of these programs in a meaningful way. This bill is nothing more than a group of racists trying to maintain their inbred kingdom. Given the explosion in political activism this past year, I think it's safe to say the morally corrupt politicians who work for the oligarchy instead of their constituents will be the ones to face a reckoning. In fact, I think the most appropriate thing to do here is making sure all the co-sponsors of this bill are replaced by refugees. But let's get back to the matter at hand. Yes, the federal government obviously is using my tax dollars to fund refugee resettlement. Oh no, how scary. But I am happy to allow that. I'd much rather have my tax dollars go to helping an innocent family resettle than bombing hospitals overseas, assisting Israel with murdering children, or supplying DHS agents with the weapons they've used to murder American citizens. In fact, if we want to help the federal government come back on unnecessary funding, we should start with the Department of War and DHS. Statistically, these two departments waste the most amount of tax dollars. And they're funneling my hard-earned money into imperialist wars that are creating all these refugees. The most important thing to remember is that our country is the chief exporter of war, and is the reason the world has been given so many refugees. We have a responsibility to help these people because we've created the situation they're in. The supporters of this bill will conveniently ignore that nuance and throw around manufactured statistics that would be right at home in the Daily Stormer. Demographic replacement was said earlier, and I would like to address that.
You got only a few minutes, a few seconds, rather. Go ahead.
That is a Nazi dog whistle, and it's specific to the Great Replacement theory. This is an idea that a global cabal is attempting to destroy the white race, and the supporters of this theory are neo-Nazis. As someone who used to work in refugee relief services, I can confidently say refugees are amazing people, and they far exceed any of the people who have testified in favor of this bill.
Okay. Any questions? See none. Thank you. Also signed up to speak is Andrew Allgood. Is Andrew still here? He's from Lebanon. Okay, no one else has signed up to testify on HB 1706FN. Does anyone else wish to testify? Seeing no one, I am going to close this public hearing. That concludes all of our hearings scheduled for today. We will be reconvening tomorrow morning at 9 a.m. to hear additional testimony on other legislation. Thank you all for being here, and we stand adjourned.